Okay. Councillor Principe, we have resolved the issue. We can resume the meeting.
Okay, wonderful. Welcome back, everyone. Let's carry on with the meeting then. I will go back to Councillor Knack to move approval of the minutes, please.
Yeah, we were in suspense waiting to approve the minutes from the April 29th, 2024 Community and Public Services Committee.
Thank you. Any questions, errors, omissions? Hearing none, please vote.
We have all the votes.
Please display the vote. And that has carried. Protocol items. I am not aware of any protocol items this morning. Next, we will select items for debate. I'll ask my colleagues to sign up to select items for debate, please. Councillor Knack.
Thank you. I'll select both items, 7.1 and 7.2.
Great, thank you. So we have items selected for debate. Vote on reports not selected for debate. We have no reports not selected. Request to speak. Mayor Sohi?
Yeah, I will move that the Community and Public Services Committee hear from the following speakers in panels when appropriate. On 7.1, updated community plan to end houselessness progress update, we will hear from Nadine Shalifu, Edmonton Coalition of Housing and Houselessness. You're here in person, great, yeah. As well as on 7.2, Nadine Shalifu, Edmonton Coalition of Housing and Houselessness. Yeah.
Thank you. Please vote.
We have all the votes.
Please display the vote. And that has carried. Requests for specific time on agenda, none. Councillor inquiries, none. Reports to be dealt with at a different meeting, none. Request to reschedule reports, none. Unfinished business, none. We are on to our first public report, item 7.1. So administration, come on down. Thank you. And whenever you're ready, you can go ahead.
Good morning. My name is Jennifer Flaman. I'm the Deputy City Manager for Community Services with the City of Edmonton. Administration is joined today by the CEO of Homeward Trust, Susan McGee, to present an update on the 2024 Community Plan to Prevent and End Homelessness. Community plans are strategic planning documents that outline the resources required and actions that need to be taken by the entire homeless serving sector to ensure all experiences of homelessness are rare, brief, and non-recurring. The report we are discussing today is a project update and includes 10 draft recommendations and a number of actions that are currently being refined through a series of engagement sessions with key stakeholders led by Homeward Trust. Responsibility for actions of the community plan are shared across allied systems of care and orders of government and cannot be achieved through any single organization. The City of Edmonton's commitment to the community plan will be detailed in the City of Edmonton's corporate homelessness plan, which is being presented to this committee on June 17. The conversation with committee members today is primarily to gather feedback and insights from council and members of the public who have come to speak. The plan will be launched with the support of community in July 2024. This report is for information only. I'll now hand it over to Susan.
Thank you very much, and thank you, Mayor and members of the committee, for allowing us this opportunity to both present an update, but I'm very much looking forward to the questions that you will have. I know that there's been evolving and shared information, and a lot has been provided in the last couple of weeks. So I will start with just, again, kind of my overview, and my presentation will be focused on kind of a very high level. I'm not going to go through each of the recommendations, and I expect that there will be some questions around the specific recommendations, but more to situate the plan and where it is at in the work that we're doing. I wanted to start with, and I don't know who to say next slide to. Next slide, okay. It just happens. It was previously referenced, and it's in the document, that we did initiate this project in ceremony and really reflected at the time on the purpose of the plan and the opportunity for a plan in an environment where so much had changed in our community. There's been a lot of change, questioning of the old and learning what has been shared both in the community and amongst partners, including the City of Edmonton and Homeward Trust. We made reference early on to images and analogies that would help us recognize what will make this plan strong. The analogy of the braid was something that was discussed in ceremony. Many of you have heard references from elders about the strength of a braid and how many strands woven together become stronger. The other aspect of a braid that we can think about is that the strands can continue to incorporate new strands, and some older strands can also come to an end without compromising the strength of the braid overall. Very much like a braid, a community plan has to rely on the strengths of things that are working, incorporate the new, and that doesn't just mean projects and programs, but also voices, interests, information, and data with the intention of improving and strengthening the work overall. With that coming together in a shared purpose, we know that we can build off of our community's past accomplishments and serve the community better in the future. New slide. Just to focus a bit on what the plan is, and maybe a little bit about what it is not. A community plan is a document that brings folks together in clear alignment and with common goals. It recognizes that there can be contention and disagreement in approaches to problems, and hopefully, out of an identified process, it supports how different points of view and perspectives are healthy and can actually make our work stronger. There is an opportunity to look at best practices not only in how we have in work we've done in our own community and accomplished, but in many different communities, and where we can build off the strengths and learn from others and evolve as a community, as community programs evolve. We also recognize that the challenges we face as a community are constantly changing, and it is also important to opportunity to consider the role of the homeless serving sector and the many other systems that it relies on and the changes in those systems. It's a reality that, for many, the services provided by agencies in the community are the last line of defense that they may have before experiencing homelessness in the first place or at all. And ultimately, if they do experience houselessness, those are the folks that are there to support them. And this is often the result of many system failures, and in some ways, the sector is picking up balls before they hit the floor. When we work together and align our efforts, we identify what those systems we can identify with those systems very clear strategies and accountabilities that we can see how we can measure and impact both positive and negatively the work in the sector. What a plan is not is an operating plan for the entire sector that prescribes to multiple stakeholders and agencies what their agencies will do. Many organizations that contribute greatly to the success of housing outcomes in our community play a significant role in many other aspects of their work, both in creating opportunities for individuals to learn, to stabilize, to become educated, to become employed, to secure food, and ultimately, those folks facing homelessness or at risk of homelessness, far too many of them struggle every day just to make ends meet. And many organizations play a significant role in just providing those basic needs. We've also heard reference to blueprints when we write plans, and many plans appropriately we might call blueprints, and I think that just can also take us into an expectation that the plan is prescriptive and designed with a final product in mind, and that we will just follow all of the details in that blueprint. And in fact, when we adhere to a plan and expect to write all the detail, everything that might happen or could happen in months to come or years to come, we will likely end up with something that will not work, is stale dated, inappropriate, and perhaps ineffective. So certainly providing the building blocks and identifying a unifying vision, but again, good plans allow for real-time and continuous learning and course adjustment. New slide. The plan also does not sit alone. It references several other documents that are very important to our community and inform decisions and priorities through which decisions need to be made. We work closely with all orders of government, and throughout the years, we have seen priorities shift and new opportunities evolve, as well as changes in the structure of the orders of government, their ministries, and the services that they provide. We need to adapt to those, and there is no hierarchy amongst those plans. It's neither a cone or a Venn diagram. So to visualize and consider where the plan fits amongst those very important documents is something to consider when we finalize this work. In addition to those orders of governments and significant informing plans, we have the community safety and well-being strategy and the city's own corporate homelessness strategy. Individual organizations have their own strategic plans and campaigns and have many initiatives. And there is research that has happened before and will continue to happen that we will continue to include. So situating the plan in the context of that as a living document helps us think about how we will manage and govern the plan. Next slide. The development of this plan has taken longer than we initially expected. In fact, we came out of a few years in a pandemic where we felt like we were writing a new plan every month with a cadence of adapting that suggested that the community plan would similarly be able to be that accelerated. In reality, it is exactly that environment that is continuously changing that has made the finalization of the full plan a full year project. It has worked to incorporate and reflect some of those changes that we've seen during this time, and we've also embraced a fairly deep dive into our current data and looking at how modeling and how we project and make decisions and how we can build an infrastructure around that data and analysis so that it is sustained throughout the plan rather than using it to just come up with some projections for today. For instance, and in doing that work well has been very important, I think, to the long-term value of the plan. Next slide. Thinking about the system and system planning overall, it can imply certainly that we have a lot of control or authority and can dictate the system. It has a great deal more value in this work to consider it in terms of just really understanding that every system, and I love this quote, that every system is perfectly designed to get the results that it does. And when we look at the process of both how programs coordinate and how the system works together, we can plan ahead more effectively. And when you think about this quote, it is also not surprising that we can look at the circumstances we're facing today and consider how, frankly, inevitable some of them are. After decades of disinvestment in affordable housing, and one of the biggest impacts that we have on our housing crisis is the lack of housing options that has gotten worse since the beginning of our plan work. That's the kind of mindset that we have when we look at planning in a system approach. Next slide. The system planning framework, I'm not going to try, you don't have to read these. But I think reflecting on the system planning framework and its value, it was circulated in the package, it is worth knowing that and understanding just how much the nuance of the programs within the system have developed, refined, the ability to compare and think about what kind of interventions we invest in and where those interventions should be led, particularly when it comes to government programs, is very, very important. Taking the time to look at and juxtapose existing programs and to identify gaps has been a considerable effort, and one that I know is going to continue to evolve, but has been very, very helpful as well in processing some of the feedback and concerns around what opportunities we have pursued and probably not even emphasized enough. I'll get to that in a minute. But also in doing this kind of work, we can redevelop into the data set that I mentioned earlier, more effective ways of analyzing and evaluating the programs that we are implementing. Next slide. The system framework focuses on certainly programs in the sector, but also new and evolving work, and takes a very high-level view of categorizing efforts around inflow and outflow so that the optimization that we focus on in the middle, if you will, can be as effective as possible. The things that have changed over the course of the last few years, and in some cases more recently, is how we have experienced 24/7 shelter operations and their role as hubs, as pilots, and how that work can be really generalized and help the system overall. We have a new navigation and support system, and I'll speak a little bit more around the evolution of coordinated access and how we are focusing right now on improving the intake and assessment process. We've also introduced over the short period of time considerable more housing options through supportive housing, and through the case management and community that has historically been kind of put together in a large umbrella of Housing First programs, has become again more nuanced with individualized processes and care. The system planning framework allows us to articulate that well and then evaluate those component parts. Next slide. Something that's been very interesting in the consultation with agencies and folks with lived and living experience has been input and feedback on access to housing and referral processes, something that has evolved in our community and has played a very positive role in our ability to align and connect folks to the right level of supports, has been a coordinated access system that has been modeled and repeated in various ways across the country. And it remains a cornerstone of our work. However, it is something too that agencies and community members have said might be contributing to perceived barriers and is something that needs improvement. We also need to consider how we are more transparent with the referral process and have more self-determination amongst individuals that we're engaging with, and in some ways use our system to empower folks in their own journey out of homelessness. That's something that we have gone through as a community from a no wrong door approach. We've had times when individual agencies centered their own evaluation and access to their programs, knowing the folks generally that they were serving, to a much larger system that currently touches approximately 6,000 people a year. So as we've evolved that and it's developed, it's no surprise that it is one of the aspects of our current system that needs to be evaluated and made more robust. New slide. Over the last approximately 15 years, we have, as a community, taken many opportunities to learn and develop and expand areas of work. We have always committed, and the initial plans to end homelessness recognized that no one program will ever end homelessness, and frankly, no one organization and no one order of government will either. But we did start our work largely focused on 35 contracts with agencies. The primary investment at the time was through intensive case management teams and ACT teams doing Housing First work and scattered site models. Since that time, we have grown not only the number of programs, the number of organizations that we engage, and the individuals that we are able to provide warm referrals to, but in that nuance, much of those investments have been in innovative models such as supported referrals, where we engage organizations that have existing programs, existing supports, and they're able to access very quickly funding to mitigate the homelessness and to facilitate a housing action for somebody. That's on the prevention and diversion end, and then we've also expanded a number of programs that have been more utilizing of different critical time intervention modalities beside the intensive case management programs that are in the Housing First model. And then certainly with the supportive housing I've mentioned earlier, we have bridge housing, which is really I think unique. Some Canadian cities have something similar, but it's something that the community has really taken advantage of, and I think segued a lot of our learning from the pandemic into the important role that continuous stay but short-term housing options like bridge housing can greatly benefit the housing outcomes for individuals. So with that expansion and the amount of new work that has happened, I think we've recognized in the consultation and engagement of the community that there's still a need for much greater awareness of what exactly those programs do and who's what agencies are providing what services, and just navigating that increased complexity in a more impactful way. Next slide. I mentioned data and how important that it has played a role historically for all of this work. But in this last year, we really dove into a significant number of records, cleaned our data, and modernized some of the infrastructure that supports our data and analytics. And with over 31,000 individuals that have been served in the program, and the ability to have modeling that now we can look at some of those journeys, it's really increased our ability to analyze, and frankly, all of this will be of great benefit to engaging some of the system partners that we know similarly have been increasing their ability to review and model their data. So this has been a fairly large undertaking. There's been, frankly, times when we had to really evaluate the value of some of that historic data and how much we needed to invest in it, but it has proven to be a great contribution to our ability to do the modeling that's going to be in the plan and will continue to be supporting it in the future. New slide. So all of this information and analysis, the inflow and then the outflow, what's working, where folks are coming from, the big focus of planning decisions, which need to be supported by some revisitation and refresh on our governance and decision-making models, is around how we optimize that system in the first place. Again, if it is a system, we believe we can optimize it, and we can identify the impacts that certain levers will have, and at least if things do not go as according to plan, we can certainly reverse engineer and understand why that was the case. So our focus is on that optimization, creating the decision-making environment to support that. We've noted in the recommendations the need for a few tables that will allow us to benefit greatly from some of the other systems and organizations around data and analytics who together we think we can greatly improve and actually share and really democratize some of the data that we are relying on. And the need for really rigorous and ongoing research tables, and to have the environment where we are constantly testing our programs and evaluating our progress in a broader community engagement. Next slide. Thinking about how the homeless serving sector situates within numerous other systems is important in being able to think about how we align our work and how we then ultimately engage those systems in what we refer to as an accountability framework. Clearly, there is no one represented constituent that can end homelessness, houselessness on its own or order of government. And when we provide the kind of mapping that we've been doing and working also with a product called Cardo, and can identify very specifically the interdependencies between the homeless serving system and these other systems, and recognize too, not just the opportunity, the responsibility, and the ambition that we have, but the limitations that we have when the sector itself only represents a small percentage of the players and the resources available. It really helps with our ability to plan and have long-term impact. Next slide. Again, to that shared accountability, I want to stress that we are not suggesting, and we cannot compel ministries, governments, other organizations to defer, and we would not expect them to defer authority to a particular table. However, I have been most inspired in my work and the time that I've been with the organization when folks who really, I believe, want to do good, want to make a difference, are empowered and given the opportunity to do so with the best information available to them. And I think we see an opportunity now with some reset around some of the tables and the different conversations that have occurred in a crisis-oriented environment, to really be reflective of that and really instill in people the opportunity and a shared opportunity to hold accountable each other with a shared vision for what we can accomplish, and we know we can accomplish it because we have already. So I do expect, though, that language around accountability may have some questions. It certainly implies that there's an authority invested in it. I think the authority that we seek and that we think will be compelling for folks is just that. I think it is the ability and the willingness to make a difference based on the very transparent access to information and knowing where we are doing things well and where we are perhaps doing harm. So with that, I will wrap up my presentation and take questions.
Thank you very much for that presentation. I will now call up our speaker, Nadine Chalifo. You can just head over to the podium there whenever you're ready. So I will just, I know you've spoken, we've spoken before, and I know you've been here in front of council before. I'll just remind you that you'll have 5 minutes to present, and the official timer will run here in chamber, and the green light will be on for 4 minutes, the yellow light for 1 minute, and then the red light will go on when your time is up. So please go ahead. We'd love to hear from you.
Okay. Do I have 2 different speaking times?
You'll get another time after the next presentation.
Fantastic.
Yeah.
Thank you. Good morning, Council and Mayor. It's a nice day today, so I'll try to be as nice as possible with my words. As far as agenda item 7.1, updated community plan to end homelessness and its progress update, I have a lot of opinions. However, the Edmonton Coalition on Housing and Homelessness, ECHO, sees this agenda item as a painful opportunity for speaking to council about a situation that threatens the ability to say we are a community where every person matters. This meeting should begin with an acknowledgement that for the past several decades, elected leaders have failed in their duties to ensure all people have adequate housing to create their homes. As we discuss this issue in the security and comfort of a city hall, nice and warm, 4 walls and a roof, around the city, the relentless assault on the people who are homeless continues. People who are ill, powerless, and without resources are being pushed from corners where they have sought some temporary shelter, in many cases with the losses of personal property, with no consideration of their human rights, and often with significant psychological trauma being inflicted or reawakened on them. They may be casually told there is room at an institutional shelter, and I want to emphasize institutional, for them, as if such places have any remote resemblance to a place where a person can create a home. ECHO is pleased to finally see some attention. Oh, that's the next one, sorry. We are apparently not being given appropriate information when it's necessary for a city, for a community, for individuals within the city. We are not being allotted full transparency and correct or accurate numbers for who are homeless, where they get to go, and how many people are dying to it. What I can say is that it's an embarrassment, it's unacceptable that we are funding more shelters for our homeless and taking them out of the ones they create that are more safe for themselves. Ones that they create in areas where there are the services that they so need to get rehoused, to get addiction supports, to get any kind of supports. They can't be pushed out of the area. That is the only place to support them as it is. Just because they're living in a not so beautiful home, it doesn't mean that it's not all that safe. I think exaggerations have been made. I think if we were to have a better, proper, and appropriate method of supporting them while we get them housed and actually do that and get them housed, then we can actually provide stable, permanent supportive housing for these people, stability in the reality that they can actually become self-sufficient, and a community member that has been able to contribute instead of having to be one that needs to use the system. Creating and duplicating places like the Navigation Center only makes places like Bissell Center, Boyle Street Services, places that have been working for decades, successfully helping house people, helping get them off the streets, helping them re-socialize and re-engage in humanity here, is where the money should go, not be taken away and given to a separate situation. We already have these things in place, and that's where that money should go. So that's where your attention should be. Thank you.
And thank you. I will go to my colleagues to ask questions now. Councillor Knack, please go ahead.
Thank you, Councillor Principe. Thank you for being here. I wanted to just, because I had a chance to read through the letter that was sent last night, and I saw at the end of the letter there was concerns specifically related to the recommendations of the report. So I guess I just wanted to double check, like, did you have sort of 3, 5, like, I'm just curious if there were specific recommendations that you feel were missing from this report that you would like to see in place in this report?
In place of the report, I can say that one of the matters that might come up, oh, sorry, this is my notes, is we're talking about how having homelessness, unsheltered people living in makeshift homes is not safe for them, but yet the mortality rate is still increasing no matter what we do. If we're not going to build the housing, we're going to keep increasing that mortality rate, that homeless factor. This plan should be delving more into some detailed plans, and there are organizations that have already figured out those statistics, those numbers, the financials for these kinds of preparations. So I think that it's just the fact that you need to do some more detailed transparency, I think is the word I want to use.
Okay. No, I appreciate that. And, I know we've had many chats before, and I wanted to just check, and this is the challenge we run into. You've been at these meetings many times before. Something like the actual construction of affordable housing, while the city has entered into that area now, dating back to about 2020, putting in quite a bit to build more units. Ultimately, the operations of these units goes through the province, through the funding that they'll provide to groups like Homeward Trust. How has your advocacy been going? Have you had any success in terms of conversations with the provincial government on that front? Because I think, in this 4-year budget cycle, we're putting in another $183 million to build, I think it's about 500 to 600 units of permanent supportive housing. Some of that funding is going to go to affordable housing. There's quite a bit that we're trying to invest instead of just doing what we used to do years ago, which was providing the land. But we still need the province to fund the operations of those supportive housing spaces when they're done. And so I'm just curious how ECHO's work with the province has gone, or has there been a lot of dialogue with Minister Nixon and that group? So. Well,
we've been attempting to make some good moves and some good conversations with them. However, they're not as transparent or receptive to our inquiries or even our conversation, or the fact that we have any influence at all in this situation, which we do. We have over almost 40 years of experience.
Exactly, yeah.
Unfortunately, this provincial leadership is not really working towards supporting and helping this situation.
Okay. No, I was just curious if, and I figured you've been trying to do that outreach too.
We haven't stopped kicking the door, though.
Good. Yeah, I wouldn't expect you to stop anytime soon. And yeah, this is, as we heard in the presentations, is how do we try to get all 3 orders of government to sort of be moving in the same direction? On certain areas it feels like we are, in certain areas it feels like we're still not quite where we need to be. So I just wanted to check in on that. Okay, those are all my questions. Thank you.
Thank you, Councillor Knack. Mr. Mayor?
Yeah. Well, thank you so much for joining us, and the perspective that you're bringing through your presentation matters to us. So thank you so much for for being here. I just want to, I agree with you that shelters are not the solution. We need more housing with wraparound services and culturally appropriate services. What I understand that the shelters that exist now offer temporary intervention, but they also include some wraparound services or access to or connection to services. They become more of a point where you go and then you can connect to other services. Is that what you're seeing in the shelters or not?
No, I'm not seeing any change. So I've been housed now 10 years myself from homelessness, and it's not all successful. Last 5 years maybe, but the first 5 were not. And that was due to no services, no wraparound services, no supports. What I'm seeing in the shelters is the same thing I'm seeing in the navigation center, is that it's all referral. It's not actual hands-on taking them and getting them housed, getting them those services. It's just referrals. If you want to pay money out for someone to give referrals, you should be giving the money to me, because that's what I've been doing for the last 10 years, for free. So, I mean, really, we're not putting our money smart, and we need to be putting it smart. I think the Navigation Center is a duplication of services that we had that were doing good work, that were actually getting people housed.
Got it.
And it had also a system where people who were unsheltered trusted those services from those organizations. They don't trust a shelter. They don't trust a navigation center that's new, that has no reputation, no relationship with these people. And unfortunately, that's a failure, huge failure on our part.
I know that some issues have been identified, particularly when people are referred, say, to housing. Are they actually able to access housing? I think that's something that our administration has identified as a gap as well from the navigation center. From your perspective, I know this report highlights that prior to COVID, our community as collectively was making, we were housing more people. We were actually trending toward ending houselessness in our city with the housing first model, where you have a place and then you get wraparound services. Is that from your perspective, is that the model that works?
I would say it's a model that has, it has the ability to be a very well-working one. It works at a very small level. Unfortunately, not enough coordination and work together through the different social services, as well as, the Housing First program organizations. There needs to be more coordination. There needs to be more collaboration. Unfortunately, there's not enough. The communication is so lax that it's failing the program. Program is now, almost 15 years old, 12 years old, 15 years old, somewhere around there. And it's still the same as it was then, and it needs to grow with the population, with the needs, and with the system.
Yeah.
And I don't see that it has.
Yeah,
Unfortunately.
You need to put more money into the system as needs are
100%.
growing particularly since COVID.
Yeah, honestly, you guys give out land, or not give out land, support land for housing, but one mistake that was made was providing the land back for Hope Mission for Herb Jameson. That could have been an entire compilation of homes for people who are homeless in an area they're already in, and in an area that the services are near them.
Okay, good. Thank you so much.
You know what I mean?
Yeah, thanks. Yeah.
Thank you. Councillor Tang?
Great, thank you so much, Nadine, for coming forward. I wasn't going to click down, but you said something that kind of tweaked something for me. Do you spend a lot of time at the Navigation Center?
No, I don't, because it's not accessible, and as you see, I need a walker to get to there.
Yeah.
And unfortunately, I can't do stairs, so.
And are you speaking with a lot of community members who are getting their referrals?
Community members and actual service providers, so people from Boyle Street, people from Bissell, people from other services, and the answer's the same. Why are we duplicating?
And, because you mentioned that, you know, people are just getting referrals, they're not actually getting accompaniments, for example, and there's difficult to see the follow-through on that. And that's based on those conversations that you're having.
It's the same kind of work that comes from Alberta Works.
Yeah.
When a person goes down there for services or supports, they're given a referral or told to go on the computer and look it up.
Interesting, okay. And, I mean, ECHO's been at it for a very long time, but you're very at the front line and talking to lots of people in the community, is that right?
Yeah.
Yeah. And I'm hearing from your presentation and then your Q&A, you know, you're asking this question of, like, how are things different? I guess from your perspective, from ECHO's perspective, what change, what shifts is needed to be different?
It's not really just a shift that needs to be made. It needs to be full accountability for our actions. If we're failing the system, and we know we're failing the system, and we know where we're failing the system, then we need to obviously put our hands into that section. So we can only make it better if we actually work together with frontline workers.
Right, and I guess accountability is an issue we've always heard about.
Yeah, but is it used, right?
So I guess that's my questions, like, can you pinpoint for me what needs to change in this accountability, for example? What player, you know, like, are there players that you know, as a community been talking about? Are there different frameworks we need to follow? I guess just a bit more on that, if you can.
We could be here a long time.
Okay.
I'll try to narrow
A
down
summary.
to one or two things. You know, it's not a perfect system. It never will be a perfect system, but we could start by actually treating each person that we're talking to on a regular basis with the same respect and trust and honesty that we want this system to be.
Okay. Great, thank you, that's all.
Thank you. Councillor Wright?
Thank you very much. Nadine, just talking about that trust there. How can we build that trust, or is it a lack of trust with the provincial system? I just want to understand that.
So we're lacking trust in all levels of government, but we're also lacking trust in our other services, our police services, our health services, even our social services. You know, we don't have enough social workers to help people, so they're just picking and choosing what they can do, unfortunately. But when I talk about the trust, I mean the trust of the unhoused people to be able to work with us, right? Because if they're not going to trust us, they're not going to come to us and say, okay, I believe you're going to give me housing, and then wait, 2 years before they even get a letter back or a conversation back. So I'm saying we need to trust each other, because if we don't trust each other, how are we going to be truthful?
Okay, so I mean, health and social services, and you mentioned Alberta Supports, and I'm guessing AISH, those are all provincial responsibilities, right?
Yeah.
So that's sort of out of the city's hands. I'm wondering, what can the city do to better people's situations?
Cap the rent.
I'm sorry?
Cap the rent rates. That would be a start. Yeah, cap them. Stop them at a certain rate for affordable housing, because it still get raised when there's someone in affordable housing, because there's different levels of affordable housing rather than, a distinct amount. This is how much you pay. According to the Canadian mortgage, whatever, they say that affordable housing is actually 30% of a person's earned income. So if you're not earning much for income and you're paying over 50% of your income that you have to your rent, that's a problem. This is something that the actual city does have some control over, especially when you own some of these affordable housing centers. So I think capping rent on those homes, those types of housing, would help the people be able to get the service they need and get out of the affordable housing, so that we can house those people that are still unhoused.
So just going back to what you said, I think what's AISH, about 1,200?
No, it's 1,700.
1,700? So 30% of that, I can't do the quick math here. About $510, I think,
Yes,
would be the max.
yeah. And right now, I pay almost $900.
So almost double. So yeah,
Yeah.
okay.
But people on return to work or barriers who still, barriers is a version of AISH, but not with the AISH benefits. Barriers still only starts at $750, right? So what's 30% of $750?
220, I'm gonna guess. Okay.
So you see where I'm going with this, right? That's one solution. I could give you a million of them. Again, we don't have that kind of time, but.
Okay, so, and if we aren't able to cap those rents or find some other alternatives to make that housing more affordable, the other option then would be to look to the province to increase those payments, is that right? Those support services?
Yes, I think if the city were to help, along with other cities and municipalities in the province, to push the government, the provincial government, to change that social system, especially for the lower ones, not just AISH, but the lower ones, they can't even earn the same amount of money I can earn on AISH. I can earn $1,000 on AISH before I start getting deducted. Those folks on return to work or barriers to full-time can only earn $230 before they start getting deducted. Tell me how under $1,000 is going to get them anywhere.
Especially, yeah, with the rising cost of food and utilities and everything else that goes along with affordability
So
crisis.
maybe we need to strong arm the province.
And you've been trying, right?
Every day.
Okay, thank you for your advocacy and your work, Nadine.
You're welcome.
Councillor Rutherford?
Yeah, thanks. I'm similar to Councillor Tang. I wasn't going to ask questions, but I feel compelled to. One of the things that you just mentioned to Councillor Wright was the suggestion around home ed and those rent things, which is something I've been advocating for in terms of tethering the rent to our market, which ultimately means affordable housing becomes more unattainable. But you criticized in the letter that you sent the task force, which I'm the council appointed member on. And that would be an example of something that we do have home ed on that task force. And that would be something that would be discussed. So I guess I'm just trying to understand, like, a lot of the things that you have suggested today that are city's responsibility come from, that corporate plan to end homelessness around how we build more housing, but also from the task force in working to address some of those concerns within our circle of control. What's before us today is the community homelessness plan, which is spearheaded by Homeward Trust and includes a lot more organizations and entities beyond just the city of Edmonton or whatnot. So I guess I just wanted to get a sense from you of what are your concerns about the task force when a lot of those points that you make are things that we are absolutely going to look at within that. And second of all, within the community space, we know Homeward Trust is predominantly funded by the provincial government. And one of the things that I have questions for Homeward Trust around is that tension between housing first and recovery-oriented care. Any thoughts on first the task force and then second that tension between housing first and recovery-oriented care that's within the report?
Well, first I see potential with the task force. Unfortunately, you're kind of like showing up late to the game, so you have a lot of catch up to do. But maybe more engagement with some more frontline people, more lived experience people, because these are your people you're trying to help. That would be better. Even if you don't have like full financial, supports because it's a provincial thing, you still have that voice that will help these people get what they need to get the supports to those people that need it. On top of that, I mentioned earlier too that this is always a work in progress. However, we need to work together and communicate together, and I think that's something still lacking. And I think the task force could improve a little bit on that, and maybe include some more people to their task force.
Yeah, it's a real tension because when we're working on the the inclusion of folks onto the task force, there's sort of a critical number that social scientists recommend for actually being more efficient. So if we start to go over that number, you get maybe more opinions, but you don't get the timely responses. So there's just a tension there that we're navigating, but I take your point there. What about my second question regarding, I know you made your comment about the shelters and the emphasis on not, putting more funding resources into shelters, but what about in that report? I was really struck by the tension between the housing first and the recovery oriented. Did you have any comments on that?
Yes, so when someone is being housed through whichever program, so whether it's E4C or Boyle Street or whomever, through the Housing First program, that's when they go to Homeward Trust for the funding for that program, for that person to get housed. There's a gap between the supports that are needed for the next 2 years, let alone 5. But 2 years, they're only giving them 6 to 12 months of support, and that's not enough to get someone reacclimated to the system.
Okay, great. Thank you for those answers. Appreciate your time today and for being here.
Thank you.
Yes, thank you. Next, we will go to questions of administration, and then we'll hear from you again after the next presentation. So questions to administration. Councillor Knack, would you like to start?
Sure, thank you. Thanks for taking the time to put together this report. Really appreciate all the work that's gone into it. So many questions, but I think I'll start with just, I don't want to get to spend too much time on it because the shelter piece isn't really the end goal. We want to get to the housing piece, which is sort of the whole point of this report, but since it is referenced in the report, with the increase in capacity, the one question, and I think I sent this over to you, Ms. Flaman, as well, have we got a sense of how all of the shelters are operating in the, it's said that they're all 24/7, but I still can't seem to figure out, like, what services are they getting throughout that entire time? Are they operating in the same way for the entire 24/7? Are they operating in a limited capacity, at certain hours of the day? Do we have that information? Does anyone have that information beyond the province right now?
Thank you for the question, Councillor. We're working on getting that information by contacting the operators directly.
Okay. Have we, so we're just going to contact each one directly and put that together and get a sense of where we're at. The province didn't have
The province has provided some information, but to get the best details, we'll have to contact them.
Yeah. Okay. That'll be helpful because I'm just trying to get a sense of if we want to improve it, I don't know what we're improving towards because I have no idea what the current baseline is for operations beyond the fact that we have a lot of beds now, which is good, but I'm trying to figure out what the gap is. So, okay. Looking forward to getting that information as best we can. I know in the province's report back in 2022, they talked about, and I think this is referenced in this report here, around trying to ensure we're all using the same sort of database. How well, I guess, where are we at right now about, so if you're going to provider 1, if you're going to housing provider 1, or if you're going to shelter operator 2, if you're going to these different spots, where are we at right now in terms of the information being fully shared amongst all the different housing providers, shelter operators, so that everyone knows where that person is in their need of support?
All of the contracted agencies that are under our data sharing agreement would have access to aspects of ETO. There's a strata in terms of whether they can see an individual's name, past experience, case management notes, depending on their relationship to managing that individual's case. So there is a governance approach to data at all times to really respect the individual rights to their own personal information. But all of those records and the 31,000 folks that I mentioned, all of those files, in some way or another, available, not necessarily individually in terms of Bob and where was Bob, but there would be individuals that are on case management files with Bob that people would be able to navigate and connect with. It's not unusual, for instance, for us to have folks looking for somebody or needing to follow up on bringing, somebody who's in a housing process and we've lost track, that we can rely on the data and then the past contacts and where that person was connected with last to try to connect with them. It's not perfect, and we do find that, of the folks that we're not able to reach, often they don't have phones or they may not have been in the community, but we do use the data to be as effective as possible.
Okay. And in terms of where that data is now and how that's evolved, and I think many of my colleagues have asked this over the last couple of years, is around making sure we understand that somebody who's been connected into housing and actually been housed, where they're at in the journey, and if they fall back into homelessness, how are we tracking that, or is that information that it's still unclear or inconsistent? Because I know that's been a challenge of trying to sort of follow along. We talked about the journey mapping, and how do we make sure we understand why somebody who might have been housed goes back into homelessness? What's the course of action to get that?
Yes, we certainly do track that. Actually, and I will kind of basket, and I'm oversimplifying, but we also have folks that during their engagement might be rehoused a few times, and we wouldn't consider those kind of back into homelessness. In fact, it's a positive outcome sometimes if the first choice of housing was not healthy and stable for them. But then we do have folks coming back in the system, and we do have that recidivism number, and just being able to cluster how and when we will see more around the 3-year mark, the largest group, and often those folks continue to be challenged with poverty. Their needs are not fully met in the system, and they do run into a housing crisis again. So the ability for the program to sustain them and mitigate that has, we can really drill down into those numbers, and we do have that data. There's also, I think, really important additional work to do to look at the prevalence of that with certain individuals and what kind of health and mental health challenges that they're facing. But definitely income is a very, very significant contributing factor.
Okay. I'm out of time. Thank you.
Thank you. Councillor Rice?
Thank you, Chair Principe. Thank you for the presentation. So the first question I would like to ask, so in terms of this is updated community plan, and what is the key difference? I know there are many recommendations in the report, but I would like to say what is the key difference and in this plan, and that we think will work for us and to continue to address this important matter. Because we heard very clearly from our speaker, I really appreciate that perspective brought up. And in the past years, and then it seems the plan, we had many plans now working. So I would like to say what's a specific difference here and will work.
So there's a couple of things that have really enhanced our knowledge of the support needs of folks and the gap between even the supportive housing models that we've been very fortunate to have and to be focused on in our community, and lower level of intensity supports, and the short duration that those supports and our colleague was speaking to that, and that we don't have supports in place that are indefinite, and the resources are time limited, and that there are gaps, and being able to, within this plan and the amount of data we now have, speak to the fact that we have very, very good evidence in support of the number of folks with complex needs for which we don't currently have sufficient and appropriate models, the level of intensity, the supports that they have. There's also in that, in order to meet that need, an opportunity to, there's a lot of reference to sharing data and greater transparency with not just programs, but with the system partners, and to be engaging in those bigger solutions that are really outside of the resources of the homeless serving sector itself. I think there's an opportunity to really engage those systems differently than we have been able to in the past with the information that we have. There's reference to governance, I think, more to come on that, but Homeward Trust has had various committees reviewing and participating in our decision-making, and it's required as part of our funding agreements with some orders of government, and in the governance and how we lead in this space, and how we need to refresh some of that again, including more lived experience and voices, and having broader engagement of those in decision-making tables. And while those tables have been there, in some ways, the kind of shared responsibility of that decision-making can be improved.
Okay, so I appreciate there's some data provided in the presentation, and specifically, I have one question related to the Housing First program, and that is demonstrated 16,000 that housings since the first housing support program. Does that refer specifically to the Housing First program, or is just a general number?
That's a total number, and the Housing First program for many years was inclusive of a few different housing models, and
Okay, so my related question to this is from Housing First program, is that a service provider and is through the Homeward Trust, or is just already and that distributed to all the community-based organization for the service provided?
so and in answering that question, I hope to kind of give a little bit of exposure to what Housing First is and isn't. And unfortunately, one of the things about Housing First, as you know, it's principle-based. There is a structure that makes Housing First most effective, and Housing First done poorly is actually not Housing First at all. And across North America, we've seen Housing First attributed to a lot of different programs that you know, the most important thing they do is that they're low barrier and they provide housing options quickly, but they don't necessarily provide the ongoing support. And I think we've, in some ways, fallen somewhat victim as a sector around that misunderstanding of Housing First as a model. So this is an opportunity, I think, in this plan, and we'll see it more in our material around refining and with greater precision what we mean in an intensive case management program and what that is. ACT models such as pathways and what those are, and those are, you know, collectively often referred to as Housing First, but not every program is Housing First in that regard. So when we look at what's effective, again, Housing First.
Sorry,
yeah.
sorry, I'm a little bit worried about my time is out, but I will come back. But thank you for that that answer, and also I have a follow-up questions.
Thank you.
Thank you.
Thank you. I will go next as a committee member. I do have a question on page 5 of attachment 2. One of the things that really stuck out to me was when I read economic policies must be reviewed to ensure that they do not inadvertently increase homelessness. So it's about halfway down the page. My question is there something that we can do as a council or not do to help? Is that like in relation to our policies? Or is this something that we will see in the plan on June 17th?
We've seen things over time that can be just even in the delivery and access of policies, whether we've become more centralized using phone-only systems, creating in the unintended consequences of procedure that then makes it more difficult to access services. Being really aware of all of those implications. There can be changes in the way rental assistance is approved and allocated and qualified for, some of them very positive. We've seen changes. I mean, it wasn't that long ago that Housing First individuals actually didn't get in the point system and qualify for rental assistance because it prioritized families, so much so that anybody who was single, can't speak, wouldn't qualify. So there's been changes in those policies. And looking at the impact of those changes and being very clear and transparent, and again, sharing of the information about what's true and what those potential impacts are in a not weaponizing way, but it is pretty clear that there's pros and cons with the policy directions that governments take.
Okay. So I'm hearing that it's government and maybe like sector as well, policies?
When we think about employment policies, I think that's primarily in the magnitude of government when we're referring to it in the system planning document, but there's also programs that we would want to look at and ensure that there isn't unintended consequences, again, to extracting some programs from a system or defunding things.
Okay, I see. All right, thank you. Those are the questions for me. Next, I'll go to Councillor Stevenson.
Yes, thank you very much. There's so many exciting things about this work. I'm trying to be efficient with my time and plan to speak to the things that I'm very excited about my closing comments, but just wanted to focus on some of the dialogue I think that we could have around this. So first of all, just really want to express my gratitude for the opportunity to provide input and have this conversation at this time. I maybe, and I will take advantage of it and probably have a few rounds of questions. I wanted to pull on sort of a big theme that I sort of saw both in the content of the reports and the form of the reports, and it's sort of this tension between the system planning, the system architecture, and then the individual's experience of going through that system. And I thought sort of two of the attachments, attachment 2 I thought was really excellent, very strong in terms of mapping out what needs to happen. Attachment 3 was a really incredible deep dive in terms of people's experience. And I'm just wondering how we weave those things together. Is your team sort of looking at some approaches of journey mapping, of maybe looking at how many contact points a person has to have in their journey, weaving in Indigenous ways of knowing around sort of more relationship versus caseload management? How are you sort of managing those tensions or looking to integrate that user experience into the system framework?
Well, there's certainly, and I appreciate the recognition, Councillor, of, if I can call it, some tensions around kind of designing things at a very high level. Things are perfect on paper, and in reality, we need to be human-centered in everything we do. So in the delivery of person-centered work and in the training of individuals delivering it, it's really important that problem solving by any means necessary is part of the culture of the delivery of the work. It doesn't mean that that's perfect either, because those individuals often still are running up against barriers and the frustration of being able to meet those promises of I can get you housing. But I think looking at the human side and ensuring that the training and the support for individuals is there to maintain that focus, and then still recognize that all of that very good work doesn't impact or change the ecosystem if we can't look at what's working at a very high level. So there's a tension, and we have to, I think, walk in both spaces at the same time. It's kind of high, and at the policy level as well as at the individual level.
Yeah, absolutely. And I think that's a great way of capturing it. Just, again, there is so much that's important in the systems planning framework and needs to be addressed. And it's just sort of, so maybe, are there plans to do, I'm trying to think of, like sort of testing the framework through a user experience. Again, if it's sort of like, just wondering that ongoing refinement, reiteration, how do we achieve that? So
I know many of our partner organizations have participated in continuous improvement initiatives as well, but I'll speak around just the kind of things that we've done with our PDSA work with Built for Zero and identifying and carving off, and sometimes it's kind of like isolating some work to be innovative. I know that the City of Edmonton has supported that as well with some of the pilots with encampments. So when you do that and you can really focus and then learn from something, for instance, right now, 2/3 of our by name list and that data is, it's a high level of turnover, and it's provisionally homeless, and many of those folks are also in systems or being discharged. So really making a commitment to what would it take to get that number down specifically, carve that off, and then just have a cohort of folks really focus on that problem and then learn from it and go through a testing of that thesis and then what we did and if it worked.
Interesting. Well, that leads to another question around, I think some of the past lived experience reports or research that have come across our desks has been around this idea of segmentation and sort of different types of folks who are experiencing homelessness that have different needs that, again, maybe isn't fully demographic, but again, sort of these segments that I think were proposed in one of the reports we had. Is that another opportunity where it's sort of like testing against the different segments, for example?
I'm not sure I'm understanding the question perfectly, but again, there's nothing perfect in this work, so I'll try it on. I think that this is another area where we hold some things in conflict. So folks have found it confusing to navigate to what the services are, and that agencies that perhaps they think they offer the same services are actually quite nuanced, so navigating that. We also see value in those nuanced services, and making sure that that value add of the unique aspect of a particular approach isn't diminishing somebody's experience is in a brokering.
I'm so
but
sorry.
They do, yeah, sorry.
I've
Yeah.
run out of time. I waited too long, but I'll come back. Thank you very much.
Thank you, Councillor Wright.
Thank you very much. Susan, you just mentioned something about a high level of turnover. But so that's not necessarily people getting placed in housing and continuing to live there. They're coming back in through the system. Is that right?
So in the provisionally homeless, those folks may be couch surfing. They have been experiencing houselessness for more than a few months, but the vast majority of people resolve their homelessness on their own, even if they do actually face another housing crisis in the future. So that means that they are not necessarily active on the list for a long time, but may come back on the list. So that group is actually, there's a lot of variation in the stories and the experiences of that group that make up that provisionally homeless. And the turnover can be that they're on it, and again, they resolve their housing situation on their own, or they also, if they're on and off, they will become part of our they would become part of our chronic and episodic homeless cohort. So unfortunately, we haven't been able to resolve their situation fast enough. But
so how long, so like, you say they resolve it on their own. So maybe they end up sleeping at a friend's place for 3 months. Is that considered resolved then? If they're coming?
So we are following up with everybody on the list regularly to determine whether they are still needing housing, even if we don't have the opportunity within the case management caseload to refer. And folks will have found housing, they will have found a roommate, they will have secured housing, they might have left the city. So in terms of folks, there's numerous reasons that somebody might leave the by name list other than having found housing through the programs that are offered, but we do track that as well.
Yeah, because that by names list, I don't think has been going down. It's just been on the increase since I've been on council. So I'm just wondering what part Nadine had mentioned about capping rent. Would that have any impact on the supportive housing sites and that people receive housing from?
Whatever the policy instrument might be, the reality is revenue is needed in the form of rent or some other subsidy to keep the lights on and ensure facilities can be operated.
So those supportive housing sites, then the operations are paid for by the province, is that right?
Individuals pay rent as well. We do have a lower level of rent, and for some of the sites they pay 30% of their income, and then it relies on some subsidy to do that. So I think, again, in order to maintain stable housing, I think it's been said, and nobody, I think, can argue with the fact that you cannot maintain housing and feed yourself and make all of your other basic needs on less than $1,000 a month. It's near impossible. So but the policy...
Not near impossible, I think it is impossible, yeah. Yes. I'm just wondering, on the one graphic that you've got there on slide 13 about understanding our role in social safety net ecosystem, I'm just wondering, like some dots are bigger than others. Does that mean that there's more emphasis or more need for those types of?
So with one of the systems that we use, we can do visualization a little bit more accurately. It wouldn't have fit on the page representative, so I wouldn't attribute those sizes to a specific either.
Because my concern on that is police is larger than housing and social services and health and education, and I would think that if we can improve those social services, housing, health, and education, that would also that would help people to find housing and to be able to address some of their other needs.
It's the map is really to visualize the connection of all of these systems and the fact that what happens in one does have an effect on the other. And when we think about the scale, there's ways of thinking about scale. It can be, total funding. It can be people. It can be levels of program. We can also weight that according to actually how much they participate in the pathway and the journey of individuals who become homeless. It's really the approach of taking an acknowledged lens and an informed lens on the fact that all of these systems impact whether we can or cannot be successful in the work that we're doing.
Okay, thank you very much. My time is up.
Thank you. Councillor Rutherford?
Yes, thank you. Same with many others. I have a lot of questions, but I want to focus on questions that haven't been asked yet. I guess one of the things that this plan talks a lot about is the system, the system, the system. And I can understand the system is kind of identified as the sector within this plan, but it doesn't talk, and it's silent to the bounding of the system with regards to regional or metropolitan Edmonton. And when we talk about inflows and outflows, I think even, Chief McPhee's talked about how much, we need to look at the context of EPS within the guise of that we get a lot of inflow from other neighboring municipalities. What kind of work or what kind of discussions have happened on the regionality of this plan?
I think that's something that we can work on more. There are aspects to the plan that inform the delivery and the prioritization of services that are Edmonton specific in terms of resources. We do have information about folks through both the count. We constellate a number of different data sources, so when we think about the count and where folks are from, the only thing that I would caution is that when we look at those numbers, every other community looks at those numbers, and there's an element of people moving in and out of every community. I was recently at a presentation with RDN on rural homelessness, and there's similar narratives that, they often are, it's suggested that a lot of the homelessness that they face in their communities is actually coming from urban centers versus otherwise. So I think having really good data and information on that is important. There is certainly an emphasis in this plan on the delivery of services in Edmonton, though.
Councillor, if I could add to that, Councillor, we are also undertaking a regional housing needs assessment in partnership with the EMRB. So that is for.
So, sorry, who is speaking?
Sorry, this is Hanny Kwan from Housing Homelessness.
Oh, sorry.
Yeah, so we're undertaking some work with the EMRB on a regional housing needs assessment as well. So that information will be forthcoming.
Will that be part of our corporate plan then that's coming?
It won't be ready yet for the corporate plan. It'll be ready in the
But
fall.
is it one of the actions that will be in the corporate plan?
No, it's not a part of the corporate plan.
Okay. So I think, because the thing that I see is so much basing this on data and informed decision-making, which I couldn't agree with more. But I feel like if we're not understanding the inflows and outflows, whether we're, people are going, I worked for Spruce Grove in housing and houselessness. People, you're right, the narratives were both, that people wanted to go to Edmonton for the services because that's where the services were, and people wanted to come to Spruce Grove because it was safer to be unhoused in Spruce Grove than downtown Edmonton. So I know both points, but my point is I feel like this, if we're looking at, this checkpoint on this strategy, my feedback to you is that it is silent on that interplay in the regional piece. And it's great that we're going to have some needs assessment, but I think about ETO, effort to outcomes, and, that is something that, what regional partners are we working with on those ETO implementation and making sure we're getting that data and sharing that data through those kind of programs.
Really appreciate the question, and we'll make sure that we include additional information, if not in the recommendations portion, but certainly within the analysis and forecasting.
Perfect. I appreciate that. And then you also talk about data, and one of the things I wanted to say is I wanted to ask specifically Homeward Trust. You used to be really good at putting up on your website the by names list data, and I just checked this morning, it hasn't been updated since January. Is there a reason why we're not updating that data as often and as frequently as we used to?
We are posting. I'm going to take that back and make sure that there isn't an issue with links or where information is. We have redone a lot of our dashboards, and we have a separate we've focused a lot in the last few months on hosting a site that self-serves for individual agencies to be able to see their caseloads and data and performance. So I will double check that there
Yeah,
hasn't been.
it's just
something-
on the, yeah, just on the main webpage. It says January 2024, a number of people on the by names list, et cetera. It hasn't been updated since then.
Okay, I'll look into that. Thanks.
I'm going to be respectful of my time and I will yield the rest of my time. Thank you, Madam Chair.
Thank you, Councillor Rutherford. Councillor Salvador?
Yeah, thank you so much. Really enjoyed reading through the report and all the attachments, and excellent work. So maybe I'll start with a pretty broad-based question. Wanted to ask about the move away from applying a specific time horizon to the plan, and what that means for the framing and, I guess, iterative or evolving nature of the work. Looking for some commentary on that, please.
Appreciate that, and I think it takes me mentally to, why 10-year plans? Why we put a stake in the ground around a timeline and a horizon? And it is important, and that we do that, and not just because we think that we can be one and done and everything's finished, but that we have the pressure and we actually then inform targets. I think that what we'll see in the targets as they're developed is that they have different horizons, and some of them much kind of shorter, and then the idea of being able to recalibrate those things as we annually get more information and have an ever-changing environment. But I think that value of putting a time on 10-year plans initially was not a naive gesture that we would be kind of resolving all issues in that time, but holding ourselves to a strategy. And it still has value to do that. We will see different timelines in the actual targets, however, when the plan is complete.
Great, thank you so much. I was also really pleased to see the inclusion of specific recommendations related to youth homelessness in particular, given that they are, of course, underrepresented. Wondering, compared to how youth homelessness has previously been positioned in the broader conversation around homelessness and the homeless serving sector, how are things different, I guess, related to youth in particular?
Well, we really have a strong sector, and the Youth Agency Collaborative plays a very significant role in kind of informing much of that work across Edmonton. Historically, we also like relying on the York University's Homeless Hub and the Youth Housing First programs that they piloted across Canada. And very much the reasons for youth homelessness are quite different than those of adults. And so the program interventions and the emphasis on building, if not family supports, and if that's not the best solution for kids, other options and other supports. So just thinking about why a youth is experiencing homelessness in the first place. And then the systems that they work with and the responsibility of those systems are also very different than adult homelessness.
Yeah, absolutely. It's just really good to see some clear focus on that. I think I'll also ask about the accountability framework. So, and maybe I'll ask about the interconnection between the systems planning framework and the concept of inflows, optimization, and outflows, and how that intersects with the accountability framework. And I'll just use an example. Like, I'm thinking, if we recognize that there is a specific identified gap in the health system for early intervention, so that inflow, what does the accountability framework say to that gap? And how, I guess, where is that accountability held if we know that there's an identified gap? Or is the expectation that by having greater transparency of data, greater transparency of ecosystem mapping, that in and of itself will provide the accountability?
So we are often in discussions about the cost of homelessness and the cost of shelters, in many cases being almost as much as housing, and within the health system, though, those costs being really significantly higher. And folks don't discharge folks into homelessness because they don't want to help them. There's policies and other circumstances that create that environment. And so being able to look at the data that we often have to get kind of once a year in our homeless count, being able to get that data more frequently and more reliably to help actually within those systems for them to explore and understand what other mitigating strategies. We've had at different times pilots that have been very effective, where there's been in-reach within systems and some discharge planning that was supported early on, or some different approaches to referrals from those organizations. Sharing the responsibility of trying to solve that problem in a different way together, as opposed to just sharing data, is what having a more kind of mutually shared responsibility table would help us do.
Great, thanks so much.
Thank you. Councillor Tang?
Great, thank you very much. And just want to provide a heads up, I probably will need a few rounds. First of all, thank you so much. As I was reflecting on this whole report, I was thinking a systems planning organization like Homeward Trust, I want to acknowledge, I think you do really monumental work in terms of trying to do this work, but also having a very delicate balancing act in responding to a lot of different demands from different orders of government and community. So I want to acknowledge that and express thanks for the work and you and the sector is doing. You know, Councillor Stevenson actually asked some really excellent questions that I'm going to dive into. But I think I'll start off with a bit of an overarching, and I guess I'm just curious, you know, this is obviously a lot of work in progress. There's a lot of shifting parts. What do you feel is different for the first time in this community plan compared to past?
I'll be a little reflective in my answer because it's not just kind of in the data. I think that I've mentioned some already. In addition to the engagement of individuals and the way that we did the engagement of individuals and lived experience voices, what has really, really significantly changed from 15 years ago is the agency of individuals and their expectation that the system work better and more effectively for them, and that they have access to the information to be empowered in their efforts to actually resolve their own homelessness as well. You know, when we started this work, there was a lot of frontline staff who had never had the money in their jeans to say, I can actually offer you housing. The most that they could do was offer them an opportunity to get on a wait list. And now they can. But over that time, that's also become like kind of like institutionalized process, and we might have even taken it for granted a bit. But what we've also seen is individuals that really 15 years ago didn't expect somebody would be able to get them housing. And right now, we have a community that expects us to do better.
And I think that agency of individuals who also want to play a role in the systems work, that was something I saw very clearly in the lived experience research. And kind of thinking about the work that has been done to date, what results from your research and collaboration with other entities trying to prevent and end homelessness garner the greatest confidence that the plan can have an impact?
So, I know the language around trust has been used as really a key factor, I think, and it is one in most relationships. We've been in an environment where I'm not sure that we largely, collectively, individually trust a lot of the information that we have or what we can do with it. And I think a really key aspect of the accountability framework, the evaluation space, the being able to sit around and actually trust each other with our data in a really intentional way is going to be very, very important to being able to change and be more impactful. I mean, there's really, really great work being done. I think there's also this tension in this plan of recognizing that there's great work to do and we still need to do some things differently. And in that, you know, the theme of being able to create an environment where folks that maybe don't agree on everything still have to trust each other to get some stuff done a little bit differently than maybe we're doing now.
That's helpful to hear, thank you. And then I wanted to just verify, because I see a few different languages being used around engaged sector leadership table. Does that not already exist? This was in the draft,
Yes.
This would have been in attachment 1.
We've had lots of tables.
Yeah,
and
we've talked about that.
and honestly, that's what we do as humans when we try to solve stuff together. We've got to like put it in our calendars, meet and work on it. But we've also had tables, and again, I worry that it's a bit lost in the amount of content. But we've also had a much broader engagement of different types of work in the last 5 years. So The Housing First Advisory Council, for instance, was a table of executives of all of the Housing First programs, and we have supportive housing organizations that overlap that. But just actually rationalizing that better.
Sorry,
is the next
30
step. Yes,
seconds. I'm just trying to sneak one more question in. I'm wondering if this is the same as the Community Plan Leadership Committee. And I was also perhaps questioning to administration, how are our MOU partners, Métis Government, Treaty 6 Confederacy, being part of those conversations?
Right.
Okay.
So
15 seconds.
no, but very integrated in processes for reporting and shared. And in that, because the Community Plan Leadership Committee is also a very diverse intersecting group of stakeholders and government and agencies. And, as has been said, there's a limit to the productivity of a group when it becomes 40. But I think having sector leadership that is doing the work and defining and improving the programs also at a very high level of planning engagement. So they're different tables.
Thank you. Councillor Knack?
Thank you. I guess if you want, I can put the motion on the floor to receive, I think it's just receipt of information because we're going to have the other conversation in June. So I'll do that. And I do have a few more questions. I think the biggest piece that sort of still keeps me up in all of this is on page 12, 13, where you go through the actual number of units that we need, the additional units that we need. And I know we're putting in a bunch of funding in this 4-year cycle to try to help with some of that. I know the feds are putting in some funding. I guess I'm curious broadly, I don't want to pick on any one order of government, at least today, or at least right now, is getting a sense of do we have enough money that is going to go in to build all of these units in the next 5 years, or 10 years, or 20 years for that matter?
You want to talk about the budget? I don't want to interrupt Handy when he's going.
Yeah, no, go ahead, please.
I mean, I don't have a number specifically for you or a perfectly clear answer, but we are working towards that, and we're already initiating conversations as well with the other orders of government on our affordable housing investment plan, which we're hoping to come in the fall.
Yeah, I guess my big question, and again, I know you don't control it, so I'm just trying to get clarity from what you have, is that do we have, because most of this ultimately gets operated by the provincial government. They provide the funding through, so they play a massive role in resolving this to the end. So have they given us a plan that says, okay, we know how much you're putting in as a city, we know how much the feds are putting in, here's how much is left, and here's how long it's going to take us to address whatever's left? Do we have that from them right now?
We don't have that right now, but as I said, those are the conversations we've initiated already. Okay. And I think it really is it's a function of the constraints and the conditions that we all have, all the orders of government, in terms of our fiscal environment. It's also a function of the ambition that we might want to put forward in terms of what we would do together.
So would you, from what I'm hearing, you're suggesting that you think we might have something this fall from the province that outlines exactly how long it will take to build the necessary amount of units, who's going to be funding it, who's going to be operating it. Like I get, that's sort of what I'm looking for, because I appreciate, like, we can have this great report, but if we don't have a clear timeline of how funding is going to get put out, who's going to be leading it, which should ultimately be the province since this is their jurisdiction, like, is that what we're hoping we're going to have in this fall from them?
I'm optimistic. I have, of course, no promises. But
I know
I'm
you
optimistic.
can't promise for them. But you've been given that indication that you should see something from them that gives that clear plan.
I think in past affordable housing investment plans, I think we've mostly undertaken an internal exercise to show council what we think is possible, and I think what I'm optimistic about this year is that we've initiated conversations already with the provincial government around what we could do.
Yeah.
And if I can just offer that your continued advocacy at the council level to the ministers is also really important. If these numbers look familiar, it's because versions of them were part of the budget requests that went from the City of Edmonton to the Government of Alberta during budget deliberations. Yeah. So I think a multi-pronged advocacy, both at the administrative and political level, will be helpful.
Okay. Do we have any? I know when we did the last round of supportive housing units, the units that have opened up sort of in the last 2 years now, those were that funding was approved without any sort of guarantee that there was going to be operating dollars, and it came in at the 11th hour. Premier Kenny stepped up and truly want to acknowledge his his work on that, because that report that came out, I think, almost days before I think the first unit was set to open, it was a bit of a gamble. And so do we have a sense, at least for the funding that we've set aside for supportive housing, that there's the associated operating dollars that will follow, or is it still right now sort of a similar place to where we were back in 2020 when we did that last round?
Again, I would say it's still in progress, and there's been no commitments made yet.
Okay. All right. Thank you.
Thank you, Councillor Rice.
Thank you. So I really appreciate those reports and information and specific to the reports and all these three attachments and from Homeward Trust, and that demonstrates and we have that strong desire to really want to make sense work. So I want to focus on the accountability framework because I understand this updated community plan, and one of the purpose is continuous improvement and how we make sure that working in the accountability framework. I would like to have a little bit of specific idea how we make sure this working, because we do not want this type of situation continuing. Next time we heard from public speaker to say, this is not working, this is failing. And then even though we tried so many things, but from accountability perspective, and what specific key message and here, and we can make sure and this updated community plan is working.
I apologize for I'm trying to make sure that I'm answering the question, because I think that how do we know it's working will be an important part of leadership tables, as well as frequent reporting and continuous improvement throughout. And then the accountability framework support of that is, I want to try this on a little bit differently. I mean, we all, anytime that we're working on complex projects, and whether we're building something or working in a management environment, we try to be really clear on what people are responsible for, what they own, and hold them accountable for doing that. But when we work in kind of shared environments where there's autonomous systems, we kind of get afraid to name it. We get afraid to say, actually, if we do this and you don't do that, we're not going to be successful. And I think the framework and the opportunity, the accountability framework, is to bring some of that thinking that we're so comfortable with in every aspect of everything else we do that's productive, where we think that we should be able to hold each other accountable, and to just be able to include that in something like this. And so it isn't, again, I want to say we can influence, but we do not have the authority to hold systems accountable. But I think this is a very familiar approach to solving many of our problems on a daily basis. And if we can incorporate that kind of pragmatism in something like ending homelessness, I think we will be much more effective.
Okay, so thank you for bringing that concern up. So I want to change to the data. The data consistency is a larger concern I have. And because my question to you is about, are you going to bring different data line to collect data, or you use the existing already provincial government has the program area to collect that data across the entire province?
Well, we won't be collecting data across the entire province. I think what I would...
No, I'm not asking that. I'm asking, do you have your separate data line to collect the data in our region area, and then, or you use the data from that system, and then province already exists, have that data? So is it two different data line?
So I apologize if I'm not answering the question, Councillor. When we have the work we've done on our data, and what we would separate as data's purpose in, I will say, three baskets. We have individual and accountable reporting in terms of the outcomes within the programs that we analyze at a program level. We use case management, individualized data to both inform like program quality, but as well the responsibility that we have for those individual files. And then as a anonymized, but also very robust data set, we can participate in more what, the language around data lakes, and how we can work with other data reliant systems and be able to share information, because we have sufficient common indicators that we would be, and fields that we would be able to work with those groups. Now, I'm a nerd, but that's not my wheelhouse.
Okay, thank you very much.
And we're very much, though, working with others
Yeah.
that are smarter than me to do that.
So I have the 20 second. I have a last question to Ms. Frame. And then, so I heard the implementation for this updated plan will be in July. And then do we have the financial supports by that time when we implemented this plan?
The completion of the community plan will identify resources required and have targets and modeling in it, but it isn't coming with a specific funding request. We are basically currently allocating our available resources to the priorities and reporting on that as the money that we do have secured currently. And then it will drive where we seek additional resources as well.
Okay, thank you very much.
Thank you, Councillor Stevenson.
Thank you. I really appreciate the focus of the report on some of the things that are working well. And I think what came through so strongly was the importance of supports and wraparound supports. I was wondering if there's an opportunity, so recognizing that the plan will identify, the types and the number of physical units that are needed, is it also possible for us to name and quantify the type of staff positions that will be needed as well? And I think of that in terms of the conversations we have with post-secondary to say, hey, we need 300 social workers over the next 5 years to actually staff these permanent supportive housing units that we're building. Or we need you to help train people in housing support positions. Just wondering if that is something that could be possible.
It certainly can be possible, and I think putting that particular lens, like that long game lens on it, would be helpful for the plan and folks seeing themselves in it, like institutions, educational institutions. There's also within the plan, there's a lot of building blocks that are also around standards and quality assurance of supportive housing, because supportive housing is an evolving model, and being more precise about those roles and those qualifications is ongoing work, but also, I would say I had not thought of it the way that you have in terms of an evolving staff contingent.
Yeah, when I think, again, it's a real strength of the report as well that staff retention is going to be a new measure moving forward. And yeah, I think quantifying that in the same way we quantify units, because again, we talk a lot about it's not just about the roof overhead, it's the supports all around. So quantifying some of those would be great. I think it also came through. I really appreciated the success that was captured around Indigenous-led initiatives and how not just access to cultural services, but sort of a cultural community and a way of knowing being so successful in many people's journey. I was wondering what role Red Road Healing Society has played in developing the community plan, recognizing that they receive the federal funds for homelessness programming.
Thank you for that. And throughout the first year of them implementing their role, we've worked with our community, our CAB committee, them participating. We work very closely around the programs that they're now implementing, and have tried to be as much a resource as possible, and at the same time know that they have their own advisory board and will be setting priorities. The whole effort of this plan isn't that it's Homeward Trust plan and we're including people in, but rather that all organizations can hear and see the needs of community in it and shape their own strategies in support of it. And also, it is dynamic, and we will continue to include them more.
Great. Yeah, I appreciate that, because I think they, in some ways, in some ways I see them potentially in the future being a systems organizer as well, and so their input and their ownership over some of this is important. But I appreciate, as you point out, that it's an organization that is evolving itself. But I think increasing opportunities for them to take that leadership role as well is important. I think maybe another attention that I see, I think the report really highlights the critical role that a systems organizer has, and I think Homeward Trust has really demonstrated excellence in many of these aspects. But it seems to me that there's a tension there between being the systems organizer and then also being called upon to be a service provider, and particularly when it comes around program evaluation. So how does your organization plan to manage that moving forward?
So as an organization, amongst the Homer Trust specific delivery space, there's we certainly have roles in coordinated access, the referral process, and basically anything that's been like centralized, like rental administration is centralized, landlord relations as it pertains to supporting landlords and mitigating risks and making them whole where we can. Those kind of programs that are shared amongst the whole system, that's kind of part of the rationale. We still evaluate our programs, and I think that those leadership tables and reporting on our work and being held accountable as we're embracing that today. The programs, actual staff delivering programs, are only in a few areas where they've either been short-term, then protracted, like we've been operating the jockey dorms, which we opened during the pandemic and continue to do so. And the timing of whether or not that's a one-year lease or the extension or the duration of it sometimes limits the opportunity for other to transition something more permanently to another organization. And we've also maintained a housing team that's been a bit of our
I
backfill.
apologize.
No, go
Sorry,
ahead.
time
I'll
is
go back. Yeah,
I'll
thank
go
you.
back to that.
Councillor Paquette?
Oh, thank you. Yeah, so just some quick questions. First of all, just remind me of some numbers. How many people experiencing homelessness right now in Edmonton?
I'm going to say approximately 3,200 because I didn't look at the number this morning, sorry.
Yeah. Okay, 3,200. Okay. And what do we estimate the cost of the public cost, of all the things that can happen and do happen, of having someone unhoused in our streets per year? I think it was something around 150. Am I right in that estimate?
So the number 100,000 has been used often. I think often when we're seeing those reports now, we will kind of aggregate and look at folks that are have more complex needs and are interacting with emergency services much more. So I wouldn't be surprised if you've seen that number as well.
Yeah, especially after inflation. Okay, so then I guess the next question then is high level. I asked this question maybe 4 years ago, 5 years ago. How much would it cost to just solve this in Edmonton? And the number I got at the time was probably around $600 million. Do we have a number now that if we said, you know what, we're just going to do this, we're going to go all in, this is what the cost would be? Understanding that there would probably be ongoing costs because you can solve what's happening right now, but that doesn't solve everything that creates the issue in the first place, right?
The final report will have some forecasts in large numbers like that for the kind of writ large application of what it's recommending. Some of the areas that have become more expensive since those earlier estimates have been in the area of supportive housing, and given the level of supports required and provided, and the models that we reflected on 10 years ago are quite different than the models that we are funding today. So I'm not going to be able to give you one number, but we will be including those roll-up of those budget numbers in the report.
Okay, all right. Probably more than 600 million too. Okay, so yeah, it's just interesting because if we've got 3,200 people, and let's say generously it's only costing us 100,000 per year. That's what, $320 million per year? Is that right? Wow. Do I have that math right? I'm just doing it off the top of my head. Anyway, it's a lot of money. So that's very interesting. Okay, that's all I needed for now. Thank you so much.
Thank you. Councillor Tang?
Great, thank you so much. I guess first, just to answer my last question about the Community Leadership Plan Committee, how are our MOU partners involved? Either.
So the MOU partner language is something.
Being Treaty 6 and yes. Confederacy and Métis government. Okay, will they be invited to the review of the plan, etc.?
So the outline of the, so much of the, if you will, population of making sure that we have a diverse enough group. There's guidelines within the federal government directives for CABs that include First Nations, Métis organizations, and a broad Indigenous representation. So to that end, we would be seeking that level of engagement and cross section of individuals. So I hope that I'm answering my part of that.
Yeah, and then for administration side, Councillor, we have been working on integrating much more closely with our MOU partners in terms of all efforts for Indigenous housing, Indigenous-led housing projects, and that work is ongoing, and we've been utilizing our Indigenous housing liaison position specifically for that kind of a role, and thus far it's been very promising.
Okay, I mean, I just want to flag this for now. As you continue to pursue those conversations, I just want to really press on the importance of those connections. I want to dive a little bit into the lived experience engagement. As you know, this is of particular interest for me. I thought in reading all the attachment, this was actually by far the most interesting part of the entire report. And since this is an opportunity for engagement, so I'll just maybe share some feedback on that. I thought it was very interesting in so many of the stories and the quotes. When I read it, I pulled out themes such as dignity, purpose, meaning, relationships, self-sufficiency, self-worth, community care. And I thought it was interesting that the key theme summarized was none of that except for community care and mentorship. It was very focused on access to service navigation, much more, I would say, deficit-focused rather than strength-based. And I also thought how interesting that the quotes and the stories from the 150 people was really resonant with what we already know from the Affordable Housing Needs Assessment done a couple years ago. References to from a house to a home to well-being, which is the title of that report a couple years ago, was specifically mentioned in this report. So I'm curious, number one, if that report was ever considered as part of this broader research. The theme around connection to self, people wanting to advocate for themselves, they want to build greater capacity, connection to families, culture, each other, to the community, was at the core of our well-being framework. Number two, I'm curious how that was used as a lens, perhaps, for this work. I guess, I had a similar thread of thinking as Councillor Stevenson's. How did that translate? Like, those are amazing stories. How did that translate to the key themes in the attachment 3, but also the recommendations? Because I see a huge disconnect there. That piece around worker retention was strong in both the lived experience researching attachment 3 and the service provider. But I don't really see a lot around worker retention from a systems perspective in a resource-scarce environment. I know we've been talking a lot about funding. I don't see that, I don't see there's going to be a huge amount of money coming into the system. Despite that, what are we capturing from the success of people who are housed and are staying housed? What is happening there with that particular worker and the stability, et cetera? How is that? How can we amplify that at the systems level? I guess maybe just to those two questions earlier around how are some passive work incorporated into this?
So all of those reports were and have been reviewed and have been part of the backdrop and probably are not noted as they should be. And I think that making those and connecting those dots in the final version is a good feedback, because you've mentioned it before, and we made sure that we did review all of that past work. And with respect to the individuals and the bias, I would say that is perhaps at this stage of writing, and it's a really valuable reflection, is that individuals and the importance of community and connection in their work isn't perhaps a perspective that the plan and the strategies of how to, that more put differently, to to position people
I
as
apologize to
successfully
have
as.
to
Okay,
interrupt.
I will try to
but
answer
we are
that.
out
later.
of time.
I can
and
pick this
I
up
need,
next
yeah,
round.
I'd just like to ask my
Yeah.
colleagues to try to keep speaking comments
And
to
I'm
the
not very
end.
concise.
And just try to ask questions at this moment, please. Councillor Rutherford, please go ahead.
Hello, thank you. I just wanted to circle back again with just a bit more feedback, I guess. Can you elaborate a little bit on the recommendation related to shelters? I'm just concerned that we're going to end up putting a lot more resources and energy into what we know is not a permanent solution.
So some of the questions earlier about just being really clear about the operating models that are available within shelters and how the programs we currently fund, Hope Mission as an example, as a shelter housing team and other supports on site, and with the evolution of their hub model, the emphasis of saying, like, we will have shelters, and shelters play an important role in making sure that they are really well connected to housing outcomes. As those models have evolved over the last only couple of years with the hubs being developed, and making sure that that is a point in the plan, that we are connecting those referral systems as quickly as possible to permanent housing.
Okay. Are we building more shelters in this plan?
No.
I'm pretty sure that there's more shelter. Are there more shelters that are still in the pipes from the current number that are targeted? I'm thinking specifically of a Hope Mission project in the ward I represent.
Councillor, it's Hanny from the Affordable Housing and Homelessness. I wouldn't position new shelters that come online either in the near future or in the distant future as necessarily a part of the community plan effort. I think, it's adjacent piece of work that we're supporting the provincial government and shelter operators with.
Yeah.
In response
But my concern, I guess, is if this is a recommendation, says increase access to. I have nothing wrong with the quality of shelter services because that goes to the dignity and the other pieces that I agree wholeheartedly that Karen Tang brought forward. I guess what I'm concerned about, and I think Councillor Paquette articulated it really well, is how much money we end up spending on people that are provisionally housed versus what it costs to actually house people. And I worry with recommendation 9 and what the answer from Ms. McGee at one point was, is that these recommendations will focus our resources rather than asking for new resources, they'll focus our resources. I'm just trying to get a sense of how recommendation 9 will affect that reallocation of resources.
I would suggest that in the context of recommendation number 9, that access is more about accessibility, as you said, the quality of services, less about increasing, and not at all about increasing capacity or investing additional dollars in new shelters. And administration would support this, for example, with the continuous improvement exercise of using the shelter standards as a tool for best practices.
Okay. And then my last question is, again, what I alluded to in my questions to the speaker around the tension with the housing first and the recovery-oriented care. Now, I know that one of the tenets of housing first, there's the principles, is recovery orientation. So I get that, but what I'm worried about, and I just want to ask this clear as day, is we're still following that first principle of housing without any barriers. We're not going to require people to accept help for recovery before they get housed, because that to me is where the discrepancy can lie. So I just want to confirm that.
Yes, I would certainly confirm that, and I think that the references that are also more apparent but have always been part of the program have been that it is recovery oriented and working with folks and connecting them to treatment is part of the journey along the way. But we are in the support of and in the interest of that recovery oriented system development, making sure that we are collecting more and clearer data so that we can provide support for and analyze what that kind of referral process is.
Yeah, I guess just again, the preconditions, I just want to make sure that it's about housing first is about stabilizing somebody first and then providing them with the resources, basically meeting their core need of housing first. And that would not be changing with what is in this report and strategy.
That's correct.
Okay, thank you.
Thank you. Councillor Paquette?
Just to speak, thanks.
Thank you. Councillor Rice?
My question is already answered. Will yield my time. Thank you.
Thank you. Councillor Stevenson?
Thank you. I think this will be my last round. Just really want to reiterate the excellent point that Councillor Tang made, just around connection with rights holders and with our MOU partners as part of this work. So appreciate that. I was wondering, as this work continues to sort of crystallize, you know, a lens that I'm wondering if we could add in here around the accountability framework is also, you know, information for donors and kind of seeing them as an audience. And I think, you know, both, of course, wearing our hats as government funders, but also for private donors. And is there a way, again, this is maybe going too far, but sort of like a certification that says, you know, we have these goals. Again, a community plan can't compel different organizations to take different approaches, but is there a way to say, hey, you know what, this organization is meeting recommendation 7, which is, you know, having the Indigenous-led cultural supports. You know, this organization is contributing its data to our central database, and just having that a bit more transparent so that when donors are looking, they can say, oh, look, this organization is meeting those collective objectives.
Mm-hmm. I will definitely take that away. It wasn't part of our engagement. It didn't come up as a recommendation. I think that there's probably a lot of power in that. Mm-hmm. And also we want to, you know, always speak with our colleagues around unintended consequences of, you know, the things that they're committing to and how their messages are relayed. So, but a good point to take away. Thank you.
And I think that's a great counterpoint as well. That could lead to more of that competition. But I think there's also that idea of like that healthy competition where we hold each other to a mutual standard, and there's a way where others outside the system can see that as well. Also, just with that, it's come up a few times, but I think just having that independent assessment of what 24/7 shelter standards means. You know, I visited a shelter recently that has, you know, been classified as meeting 24/7, but it was the middle of the day and it was entirely empty because there was a cleaning cycle, right? So again, as much as that may be needed on a practical basis, for me, that's not meeting the 24/7 shelter standard expectations. A few very last things. So pleased to see the focus on youth in recommendations 9 and 10, and really appreciate building off the work that's already happening through YAC. I did think there was an interesting thread around the specific experience of women experiencing homelessness and at risk of homelessness, and just wondering, again, it gets hard. There's so much intersectionality that happens, but just wondering if there was some thought of weaving that in a little bit more in the recommendations about how that might be achieved to address those specific needs.
Again, I think when we get more granular, we will see some of those demographics, but we will definitely take that away. And also, it's an important point as to how, again, our system has changed, and some of the programs that have been highly focused on women. There's both new programs, and there's been an evolution around kind of the approaches of some of those shelters to be very long-term focused, which I think it's really important that we reflect that in the updated plan.
Great. And then the last one, just around data. Just to throw out an idea, you know, Run With It Analytics is an organization that uses synthetic data to sort of map out population responses. They've recently done a project with United Way to look at how different interventions impact social outcomes. So just wanted to flag that as potentially an opportunity. I really appreciate the data focus and sort of they may be able to offer, because they have a whole synthetic Edmonton. They have a lot of detail in our community. It may be a way to leverage some of that data and translate it into something that's really, really actionable.
Thank you.
Perfect. I'll have lots to speak on, but again, thank you so much for the work.
Thank you, Councillor Stevenson. Councillor Tang.
Great, thank you. I took it, you know, you said that this is an opportunity to provide engagement. It's hard to do that just through Q&A. And so just a couple other points from the lived experience that I didn't see, and perhaps it's in there and I just can't find it, One is around people, and multiple people suggested, for example, page 7, 12, 14, suggested new roles, testing new roles, peer support, hiring one of us who have that lived experience to play a role in the system. I'm curious, what are we doing with a finding like that? Because I think that is also, we've heard before in past ethnographic research. So I think that's one piece that I didn't really see translated in the key themes for the lived experience and also the recommendations. And this goes along with what I said earlier about people wanting to play a role and wanting to have more direct connection with decision makers. That was also really loud and clear for me.
Right. So there's a number of opportunities for expansion for sure around that engagement. That we do have most of the teams or organizations complementing the teams have peer support roles, but it is something that we've seen a lot of benefit from having that embedded in a team. And so that's something that we've...
Yeah, and I think what I'm hearing from you is also, it's embedded in the more of the formal structures, right, within some of the organizations and agencies. I think what I'm hearing from the research is actually the informal networks.
Right.
People directly living it in the community, and how can they serve a different purpose to the community? That's what I'm hearing, and that's another, so I just want to flag that. And I will say one more, which is around capacity building and then that self-sufficiency. Some of the people said that they wanted to advocate for themselves, but didn't necessarily have the resource or know-how. We've seen that in past research as well. And how are we building that capacity in the community, not just for agencies, but for individuals themselves, is something I thought was really interesting, but didn't necessarily translate it at the systems level. Just something to think about.
And I really appreciate that. I think there's, as I was, just to wrap it up, the bias towards kind of finding the solutions in the way that this is written, which is to position people as well as possible for that successful connection to community, for that well-being, but then not articulating enough at the stage that we're at, what that might look like and how that can be supported. And some of that is, where can people go and how can they make those healthy connections, and to provide more content on that. So I appreciate that.
And I want to shift gear a little bit towards sort of this notion of shared language, which you talk quite a bit in attachment 2. And there's different, I think, framework, and I think there's the compass ontology and classifications. Quite frankly, a lot of it was a lot to absorb and difficult. I feel I was like, if I were just a regular person, how do I even understand all this? The language is around inflow, outflow, optimization. Is this something everyone, like for example on page 6 to 7, like all the sector players, is that something that everyone's using?
The language?
Yeah. Or is that more of a inside baseball thing?
I don't think, it's certainly not unique to, and I think when we look at national plans and a lot of policy environments, we will find like that's more and more the way that folks are talking about the work, but it definitely isn't like a common public part of our vernacular. So.
Yeah, and so when I think I think community plan is a great opportunity to have some of that shared language that members of the public, members who are
more accessible.
And members who are directly experiencing the challenges of homelessness, even across the government. This is something I've noted in our conversations with different orders, is that we're not even using the same language. So how can a community plan be an opportunity to recalibrate? And if even this is the framework that is really intuitive for everyone. I'm gonna need another round on this, Madam Chair. I guess. Yeah, I think a big thing that was a bit missing for me is in all the framework and all this, when it talks of sector, community is in reference to agencies and organizations, and I don't see a role for individual Edmontonians. And we've seen some successes with that, and people do want to play a role, even those who are housed and unhoused. Where is a place for them in the system?
I will take that away, and I think as many of the organizations we work with rely very heavily on volunteers. We've had various roles that even, the faith community at one point played a lot of kind of follow-up and relationship building roles through volunteers. And I think to not be kind of prescriptive to those organizations that work a lot with volunteers to understand more what those roles are and how they can support the plan more is a good place for us to follow up on that.
Yeah, I can't sign on. for
Yeah,
some
so
reason.
I don't see anyone else signed up for questions, so please, you can go on another round.
Thank
Councillor
you.
Tang.
Maybe just to follow up on that, I guess what I'm asking for isn't necessarily volunteer roles, more formalized sector. I would be really curious for those who mentioned that they would like to see new roles on the street. What do they mean by that? And just that kind of iterative conversation with folks who are directly impacted, I think would be really interesting. And, I think the last thread I'll just have is around the data sharing. And this is something, we saw recently with Councillor Carmel's inquiry around social services. We saw it with past conversations around community safety and well-being. This came up again here. I guess I'm just wondering, because I'm aware that Youth Agency Collaborative is developing something similar to sort of a not uniform, but like a shared data platform. To facilitate some of that. I was made aware recently Health Cities is also developing something with the principle of every door is the right door. How are we learning from those conversations? Are we working across, and these are not synthetic data, these are real data, and I'm curious, what conversation is happening? Because there's work out there happening, right?
So on those specifically, we haven't got, I would say, a formal approach to that. But how we've perceived the future of the data that we are custodians for is to be able to have it accessible, and again, to share databases, being able to, and the whole modeling of, regardless of what CRM or case management tool, or if we change whatever our platform is in the future, the data lake concept, and as well the government of Alberta has been working with other communities in Alberta about transitioning to different plans with in mind that we can advance this work better if we can have shareable data sets and there's, again, much smarter people than me, because we will continue to see in groups work on individual, expansive, but still unique data sets. So thinking ahead to how our data set can be engaged with those is kind of where we're at right now. We don't have the answer to which sets and what we'll do with it, but the preparation and the intent of being able to do that is what's behind it.
And I hope whatever the process is, or whatever the pathway together, and what's the right set of data set, the outcome is every door is the right door. And I think there's lots of research out there around that notion, and I just want to make sure that's the outcome we're aiming for, right? I appreciate the opportunity with administration to have, just even met prior to this. I didn't read the reports at the time. I have a lot more feedback now that I'm not going to be able to capture in 5 minutes. So happy to, continue talking and provide some of that input. And that's it for me. Thank you.
Thank you, Councillor Tang. I'm not seeing any more questions to administration at this time. So we will go on to speaking to the report. Councillor Paquette, please go ahead.
Yeah, thank you, Madam Chair. Thank you, everyone, for your questions, and to everyone who gave great answers. I was asking about dollars a little bit earlier, and although I was shocked in the moment, my mental calculations were correct. We're talking about $320 million cost to the system per year if we're looking at 3,200 unhoused people at about a cost of, generously, on the low side, $100,000 per year. That's astounding. People talk about waste in the system. At council, we debate figures as low as $20,000 just to try to shave percentages off of property tax. And the system is spending over $320,000 a year just to manage, or just to not manage effectively, the number of homeless people we have. It's astounding. You take that over 5 years, you're talking about $1.6 billion over 5 years. It would cost less than that to have the appropriate units and wraparound services that people need in order to get their lives back on track. It's actually incredible. So why would a government not want to save money? That's the big question that I have. You know, even if we were to try to do this just on a municipal level, so, you know, fine, we'll do it ourselves. We can't. If the bills on the table at the provincial level are passed, we can't do that because the province would not allow us to do it. So we rely on the federal government and the provincial government to actually inject the dollars to save the public money, plus save lives. I don't know what we're waiting for. I've asked and I've asked. I have not ever once received an adequate answer. We are the level of government that sees these problems more directly on an everyday basis. We hear about it more directly from the public on an everyday basis, and yet we are the level of government with the least capacity to tackle this astounding problem, which can be tackled, which is bleeding money from our system. If someone has a great answer for why we are not doing this as a society on all levels of government, I'd love to hear it. I'd love to hear it. Look, let's say it costs $1 billion to build the housing and the wraparound services. The build is a one-time cost. The services are ongoing, and yet the services would cost far less than what we're paying right now doing nothing. And it's not fair to say we're doing nothing, but we're certainly not doing the things that need to be done. And when I say we, I'm including all levels of government, but on the city level, we are doing everything we can at max capacity. So for the public who's frustrated, for organizations who are frustrated, for people who have family on the streets who are dying, I don't know what to tell you. We're doing everything we can on a municipal level, and we need the provincial and federal government to step up, and we need them to sort out their jurisdictional problems. We need them to sort out their political issues. We need them to sort out their relationship with Indigenous peoples and just get the job done. Thank you, Madam Chair.
Thank you. Councillor Stevenson?
Thank you very much. I want to start by recognizing the work of Homer Trust. You know, the report says that we're shifting from crisis to systems planning. And, you know, while I think it's great that we're getting back to systems planning, I think, you know, arguably we're not out of crisis. That has a huge impact on the individuals who are working in this space. And there hasn't been an opportunity to even take a breath after the most intense periods of crisis. So just want to thank you, acknowledge the work you do and the toll it takes, and the tremendous service that it is to our city. So I'm a very linear thinker. I think in number of units, you know, attachment 2 with the systems framework, I love all that. These are all, of course, critical pieces for success, but, you know, increasingly, I think evidence is, and learnings from my colleagues like Councillor Tang, is that we really need to do more than that to be successful. A line that really stood out to me from one of the participants was housing with heart. And I think that really captures what our system needs to feel like. Being guided by lived experience is challenging. It's challenging. You see that in the dissonance between, you know, attachments 2 and attachments 3. It's a very difficult task, and, you know, not one that I think I can do or wrap my head around. But there are pathways to doing that. I think working with the users of a system to design the system is incredibly powerful, and we see some of that work starting in an exciting way. And I, you know, just really want to take this opportunity to encourage that be even further embedded and entrenched in the work ahead. An analogy I want to share is the Stollery Children's Hospital. So, you know, that design team talked to kids who had spent time there, you know, really listened to their experience and heard over and over again how awful the hallways were. Kids just hated the hallways, hated being wheeled down these hallways. It was these long distances. It was feeling very disconnected. And so the design team actually figured out a way to build a building without hallways. It seems sort of impossible, but it happened. It happened. And that's sort of the challenge. I think that's the goal. Can we create a housing system without hallways, where people can be held in a relationship throughout their journey? And with that, sort of putting out that call, I also think it's important, and I really appreciate the idea of focusing on new measures of success. There's a real tension between resources and effectiveness. So I often hear, well, our efforts aren't working because we still have houselessness. I would argue that we have a ton of very effective programs, and the issue is just that we can't scale them up. We don't have the resources, we don't have the funding. It's not a gap, again, in the effectiveness of the programs, it's just the resources. So I think focusing measures of success on individuals' experience, on what works, not only allows us to focus on the factors that we can control. We can't control all the inflows and outflows, but we can control people's experience within the systems that we have influence over. But it also provides us a way to really advocate for additional resources when we can show those successes and really substantiate those. So I'll leave it there, but just want to say thank you again so much for the work. I'm really excited for the next, as this work is finalized, and how that will inform our corporate plan as well as an organization, so that we can support this work as much as possible. Thank you.
Thank you, Councillor Stevenson. So we are at 11:59. We will take our break now. Is it, no one else is going to sign up to speak to this? All right, I'm good to extend orders to finish this item.
I'll move that.
Wonderful, thank you. We'll need to vote on extending orders. Please vote.
Yes.
We're just getting the vote loaded into eScribe.
Can we get verbal yeses? Oh, there we go.
Councillor Rice is a yes. Thank you, Councillor Rice. Mayor Sohi's absent. We have all the votes.
Please display the vote. And that has carried. Please go ahead, Councillor Tang.
Great, thank you. Thank you all for the work. I know the project team extends beyond the delegation here, so I want to appreciate everyone's work on this. I want to maybe spend my 5 minutes a little bit on shifts that are needed. I asked this to our speakers earlier. I asked, the delegation this a little bit. I think one of my worry when I was reading through this is, are we just talking about more of the same? Languages around and themes around funding, service navigation, as a service are quite frankly what we've been talking about for years. And part of it, I think is a failure around the system that a lot of that hasn't shifted. There's more work that needs to be done, absolutely. But I also think since the last time community plan was made, a lot has happened. For example, we learned a lot from Camp Pekiwewen. It came up during the lived experience research, and I know there's obviously a lot of contention there, but we also heard from a lot of who experienced it, volunteered there, that there was a strong sense of community. There was actually a lot of positive aspect. We also saw how community care networks and mutual aid movements really blossomed during COVID, and now they play a much more prominent role in this sector than ever before. We've also seen projects like SOLAS that, Susan, you referenced, and Oracle that looks to build the capacity for residents, both house and non-house, and support them in forming unconventional relationships. We have rich data and stories firsthand from people with lived and living experiences, eager to work with decision makers rather than just receive whatever decision they're going to get. So I think we've seen a lot of these new developments, yet it's not necessarily translated in this community plan update. And I think that shift is critical, and I know you see it. And so, not that I have any voting power here, but I want to give you the permission to explore and dive deeper into those shifts. Otherwise, more of the same, to me, is not going to make a huge transformation. And I think as a community, we need the courage to keep pursuing those kinds of shifts. I was really struck by, like I mentioned, I thought the lived experience engagement was excellent. I was particularly struck by the researcher statement at the very beginning by Peyton. And reading through the whole thing, I was so curious, and if there's an opportunity later, we'd love to hear what the response would be with this question of why me, how come I made it out? And what the answer is to that at the end of all this. And if the answer is adequately reflected in what is presented in front of us. And I want to really just, put some emphasis on that particular body of work is that we've heard from people who are living rough over and over again. As you said, Susan, that now we're seeing people with greater agency, absolutely, and they're voicing that. They want to be empowered and be involved as active agents in the decision-making that affect their everyday lives. People talked about the power of informal networks, the role of community care, peer mentors, and supports. I hope, these things will also manifest themselves in the final community plan. And I think we should be building on that momentum because I think that's where the linkage with the systems level change can be made. I also think a lot of these, what is happening here, we didn't really talk about the Housing and Houses Task Force, but I think there are some really great lessons that the task force should really reflect on. What's the problem we're trying to solve, from whose perspective and experience, and what shifts are required to move the needle even just a little bit. I stress on this point around shared language and framing. And I will reference again to the framework out of the EU, themes around universal prevention, upstream crisis, emergency and repeat prevention are just a lot more intuitive, and is a way, and I think having a good framework is a way to get everyone on the same page. So I see the community plan as an opportunity, the corporate plan as an opportunity, and also the housing task force as an opportunity as well. So I think a lot has been done, and I hope we make stronger linkage between the individual lived experience and the systems change. And I know the linkage is there. I know you know that, and I hope you have that courage. I hope we as a community have the courage to do things differently. Thank you.
Thank you, Councillor Tang. Please vote.
We have all the votes.
Please display the vote. And that has carried. Okay, so we will recess now for lunch and be back at 1:30. Thank you, everyone.
From the chamber.
Afternoon. Welcome back, everyone. I would like to call this meeting back to order, and I will start by doing a roll call. Councillor Knack.
Good afternoon.
Good afternoon. Councillor Rice.
Good afternoon.
Good afternoon. Councillor Paquette.
Good afternoon.
Good afternoon. And Mayor Sohi, are you online yet? Not yet. He'll likely be joining us later. Councillor Wright.
Good afternoon.
Good afternoon. Councillor Stevenson.
Good afternoon.
Good afternoon. And at this time, I am not seeing anyone else online, any of my other council colleagues. So now we will carry on with our agenda, item 7.2. And I'll just pass it over to administration.
There's just another speaker that registered, so I might move that we hear or add to the panel for 7.2, Jordan Morgan.
Oh, thank you. I was not aware of that. Thank you very much for letting us know. I will ask my colleagues to please vote on hearing from that speaker. And I am a yes.
Thank you. We have all the votes.
Please display the vote. And that has carried. All right, now we'll go to administration for presentation. Thank you.
Thank you. I'm Jennifer Famlin, Deputy City Manager for Community Services. With me today are a number of folks from our Social Development Branch, Edmonton Fire Rescue Services, and Legal Services available to answer your questions. At the February 7th, 2023 Community and Public Services Committee meeting, City Administration was motioned to work with the Office of the Chief Medical Examiner, or OCME, of the Government of Alberta to provide a report to Committee on deaths related to unhoused populations. The report in front of you today was written using information provided by the OCME, which holds the primary responsibility for managing mortality rate data in Alberta. This report is for information only, and no decision is required at this time. Before I provide a summary of the content of this report, I want to express my sincerest condolences to those who have lost family and friends who may be counted in the numbers provided by the OCME. We acknowledge that administrative reports like this one are not well positioned to capture the unique contributions each one of these individuals made to their community. The OCME reviews deaths under the Fatality Inquiries Act, investigating sudden, unexpected, or unexplained deaths. The OCME process determines the deceased identity, date and place of death, cause and manner of death. They handle cases of homicidal violence, suicide, accidents, unexpected deaths in apparent good health, unattended deaths, deaths in government care, for example, mental health facilities, suspicious deaths, and medical assistance in dying. Not all deaths in Alberta are investigated by the OCME. Natural deaths, for example, dying from a disease like cancer, may not be investigated. There are a few data collection considerations provided by the OCME that we would like to note. The OCME stated that in their records, homelessness could encompass individuals living on the street, in shelters, temporarily staying with friends, or experiencing other forms of housing instability. If provided, this information is labeled as no fixed address in death reports, rather than specifically noted as homeless. However, as housing status wasn't a mandatory data element collected by the OCME prior to 2022, the statistics may contain inaccuracies. In addition, the OCME generally does not investigate deaths that occur in hospitals when those deaths were due to natural causes. Representatives from the OCME were invited to join the delegation today, but were unable to participate. We will do our best to answer any questions you may have, noting that we are limited in information we can provide regarding how fatality data is collected, analyzed, and shared beyond what is written in this report. With that, we are happy to answer any questions you may have.
Thank you for that presentation, and thank you for acknowledging and giving your condolences. That was very considerate and thoughtful of you, and I would like to express our condolences as well to all those family and friends. At this time, we will go to our speaker, Nadine Chalafu. Please go ahead. You have 5 minutes.
Good afternoon, Council. It's good to be back. I have so much more to say. So on this matter of the deaths, let's see here. So ECHO is pleased to finally see some attention to these mortality in relation to homelessness. Since 2005, we have gathered ourselves information each year to identify people who have died due to homelessness. We have been careful to ensure our work was as cautious as possible, and at first our counts were 50 people or less a year. They increased until 150 or 200 or more was the usual figure. This year, we will be announcing shortly a total of deaths for 2023 twice as high as ever before. You're being told by your own administration that there are only 302 deaths last year. In 2022, there were 7,521 deaths in Edmonton, but for one death for every 146 people. There were 160 deaths of people who were homeless, or one for every 18 people. Deaths from homelessness are roughly comparable to deaths from stroke and breast cancer. It has been disappointing that each year members of City Council attend the memorial service to honor and grieve the lives of these people. Yet in 18 years, none have ever approached ECHO to explore why so many die and the needs to happen to stop it. In the context of this disturbing reality, we look at the update that you are considering on the community plan to end homelessness. It is a bland and technical document that gives us no sense of understanding what homelessness really means and how urgent it is to end it. It speaks of continued improvement, but never admits of consistent failure to act adequately on this catastrophe. The report graph, however, for 25 years, there has been week in and week out around 2,000 people or more homeless, a picture of utter failure. The report provides information on consultation with people living in homelessness and people working with service providers. Input with these groups of knowledgeable sources describes major problems, and yet of the 10 recommendations, 7 deal primarily with technical issues and secondary matters, not with the heart of the issue. How to stop having thousands of people living and dying in misery. There's a difference between gathering comments from people with lived experience of homelessness and actually engaging with them in action. Consultation is not collaboration. One of the recommendations in the plan to end homelessness is to improve the shelter system. The idea of the shelter spaces available, the need for housing, and has been addressed as flawed perspective. This is also a source of how people die due to homelessness. Please do not content with the milky toast recommendations of this report. Act with boldness to show you are leaders who do not believe some of our sisters and brothers should be treated as second class. And to be in comparison here, I want to state that in 2005, we calculated 32 people died in the Edmonton area. 2006, 41. 2007, 44. 2008, 47. 2009, 46. 2010, 57. Jump 10 years to 2020, 132 people died. 2021, 222 people died. 2022, 160. 2023, we're looking at over 400. Thank you.
Thank you for being here today. Next, I will call Jordan Morgan up. Hi there.
Hello.
Hi, you have 5 minutes, please. Go ahead.
Perfect. Thank you so much for having me, everyone. As stated, my name is Jordan Morgan, and I'm here as a private citizen, more so than any organizations I work within. Definitely a community stakeholder, community problem solver, if you will. And I want to, I guess I also want to thank all the counselors and the Homer Trust representation and ECHO and everybody for being here. So my question is, how probable is it for there to be, I don't want to use the term subcommittee because the last thing we need is more committees, but or some type of community involvement within the task force space. I moved downtown from St. Albert to be closer to the unhoused community that I help serve in my spare time. I've personally taken over 25 people through the Navigation Support Center. It's great for what the model is for getting ID, getting support through HS or Radius, etc. But there's obviously still some disconnect when it comes to housing. Housing is obviously very complex, and many people have different complexities to their situations that don't allow for immediate housing coming out of a facility like that. But yeah, I'm sorry, I obviously didn't plan on speaking, so I'm a little rattled at the moment. But yeah, basically just trying to see if there's a way for any community involvement to help with solutions, because if we all have a collaborative approach, and if there is room at the table for more than just the 16 players that are currently there, we can learn who all of the players in that space are and how we can pool resources and start working on a plan together, I suppose. And yeah, that's it. That's my question.
Thank you very much, and I'll have you just hold on there because
yes,
we're going to
sure.
go to questions of our speakers. I'm
God.
sure there might be some questions for you. So, Councillor Knack, you selected this item. Do you have any questions at this time? Not yet? Okay, Councillor Stevenson, please go ahead.
Thank you very much. Thank you to both of our speakers. Really appreciate the perspectives. To Ms. Shalifu, thank you so much. You know, I really appreciate the count that ECHO has kept over the years. I mean, it's heartbreaking, but you know, I think it does a great job of closing some of those gaps that I think we heard exist in the more formal data sets, that it could be someone who is well known, who maybe experienced homelessness, but at the time of death was housed. So having those social networks to fill in those gaps is incredibly important. So thank you for helping us get to a truer picture of what the loss is in our community year after year. I just wanted to, you know, sort of take up that offer that was provided in the letter, which I appreciate, in terms of, you know, what are some of those things that ECHO sees in terms of the high mortality rates? I mean, I'm assuming obviously adequate solutions, housing, supports, all the rest are really critical, but are there other points you wanted to raise or flag for us?
Oh, absolutely. First of all, our numbers are actually garnered by a criteria that includes people who have been either recently housed or in transition housing, call a shelter their home and use that address. Like you said, the Office of the
Chief Medical Examiner.
Thank you.
Yeah.
They only consider deaths from what they see with no fixed address. Someone who's couch serving might have a friend's house as their address, but it's not their home. So if they die due to the circumstances of being homeless and having to need the housing of their own, these are numbers that we consider, which are not normally considered by counties and cities because they follow the office, so they don't really recommend or represent a full picture, which is why we do this every year. But things that could help change that is, instead of putting money into shelters, putting it into transition housing, putting it into more social housing. The city of Edmonton sold off a bunch of their own home ed properties, which they could have done and bought some new ones or built some new ones. But instead they sold some off, and that's just like, we're hoping, you know, they go into affordable housing providers' hands. Otherwise they're going to go into private, and that could be very, very detrimental to somebody like myself who requires that subsidy to live in my apartment. So without that, if I have a private owner, they're not going to get that subsidy or give it to me, and that puts me in a precarious position to become homeless yet again. These are the mitigating instances that really the city themselves could actually have a hand in changing.
Great, thank you very much. No further questions.
Thank you, Councillor Stevenson. I don't see any other questions. You know what, I will quickly sign up just to ask a question. And you know, you both speakers said very similar things. Nadine, you said about engaging with action. I like those words. And community involvement in the task force. So kind of, you know, the same concept. Could each of you speak to that? Like, is there something specific how we can do a better job engaging with action?
Yeah, there's several ways. I think the most obvious first notion I would give would be to spend your time talking to these people in person, to going down there, not just during an encampment removal wave, or not just during, a fancy news report wave. Just go down there any time of day, any time of year, and just go down there. I think it should be a regular thing that counselors engage with these people that are either unhoused or are slowly moving through the system to be housed and be stable. Because you can get housed, you're not stable, right? Just because you have four walls and a roof, that doesn't mean you have a home. And without a home, you don't have stability because your mental health is still in detriment. So with the engagement, being a part of that system is actually learning it. Maybe incorporate more peers on your councils, on your committees, as your guidance, because that is where the experience and the knowledge will really be. Bless you, Councillor Tang. But I think it has to be an engagement with purpose and intent to follow through. And I think that's where we lack a lot of, is on our follow through.
Thank you very much. Jordan, would you like to?
As Nadine mentioned, like when you're just surviving, you can't dream. Like it's very important to have a community focus, and for how Councillor Tang spoke to the dignity, self-sufficiency, and purpose. A lot of individuals who I've interacted with are just lost. They don't have family. They don't have people that care. So it's much like a CEO coming to his workers or her workers and, saying, "How's your day? I like your tie," or whatever. And it builds that sense of where people want to do better. So I think by taking some individuals as, the informal networks, which is also what Councillor Tang spoke to, is bringing in people such as myself, people that consistently, and same with Nadine and other people we know that do outreach and stuff, people that are actively in the community, bringing some people that are from your positions and actually talking to people, sitting down with them and listening to their stories could drastically change, I think, the outcome of what's happening in our city. Because people are just lost. It's so, I was speaking with Councillor Knack, and I think I've cried more in the last 4 months of my life at 37 than I have ever before. Like, everybody has a story, but there's a lot of barriers, and people just need someone to talk to sometimes. And there should be some type of cross between like calling 211 and getting the help, or not the help team, sorry, getting a crisis diversion team to come, or getting EPS to come. And not even the help team. There needs to be an intermediary that can help with people's mental health. Because even Access 24/7 is not a directive to if someone's experiencing psychosis or if they're having a hard time. But sorry, it's off out of scope, but people just need somebody to talk to.
Well said. Okay, those are the only questions for me. Councillor Paquette, please go ahead.
Oh, thank you. So on top of this issue, we've also had 1,867 opioid deaths in 2023. I think that might have been mentioned, but that's huge. That's large. The numbers are not going down. And so I guess my question for our speakers is that there are very clear governmental responsibilities in the charter, or actually in the Constitution, and by the province's own legislation. They are in charge of housing in Alberta. The federal government has recognized that maybe backtracking from their social housing programs starting in the 90s was probably a mistake, and they're starting to make that a little bit more whole. But in the meantime, the city of Edmonton is kind of outside of our lane on this. And we keep getting lectured about staying in our lane. We have, I believe it's 10 social workers, which has been criticized. Home Ed is our own spool-off corporation that provides under market housing, and that is outside of our lane. And the province is now looking at passing bills that would allow them to tell us to get back in our lane. So that would be taken out of our hands too. So understanding that we're trying to do everything we can as a municipality. Do you feel the solution is sort of adjusting how we're approaching on these sort of smaller levels, or do you feel like that there should be a larger conversation here with the province and the federal government about actual investment in housing? Because we're doing everything we can, but we can't do it alone. It's actually impossible for us to do it alone. So I don't know who wants to pick up on that.
I would love to respond to that, Councillor Paquette. You're always so well spoken. I always appreciate what you say. There definitely needs to be a bigger conversation and have more. I guess as a community stakeholder, I have an expectation of my city councillors being a liaison between the municipal affairs and then what the GOA has going on.
Yep.
And yeah, there has to be a bigger conversation because like the path to recovery is community. So we need housing to create more communities. So that's, it's a bigger issue than just, I know it's not your particular, like in your lane or whatever, but
yeah. Okay, well, thank you for that. Yeah, because the fact is we would love to do more. And we're always looking for ways to do more. The reports today indicate that, just the fact that Councillor Cartmel made this, I don't know if it was a motion or inquiry, that indicates that as well. But we run into a position where we are legally constrained and financially constrained. And we're pushing past those limits. And we're sort of getting in trouble for that. So what we are trying to do, as you heard with Homer Trust, is finding creative ways to work within those limits. But that can only go so far without actual investment. So I guess my question would be, if you are looking for something to do in the community, you can look at maybe sort of ways to maximize what we've already got, which is good. Or we can look at ways to work with council and with the rest of Edmontonians to try to communicate this issue clearly to the province and the federal government that this is a solvable problem and that by not solving it, we are wasting money. Like the money that we are spending not solving it could be used to solve it. So your thoughts on that?
I 100% agree with you. I know the estimation of our unhoused community members sits around 3,200. I'd say that's very lean, but even if, as you mentioned earlier, at $100,000 per individual, that is $320 million. So say there's 600 or 6,000 unhoused community members, 600 million would, alleviate the current pressures and the residual amounts of money that's being spent year after year after year, and nothing changing. If anything, it's been getting worse.
Yeah. All right. Thank you for that.
Councillor Tang?
Do you want to respond to any of that, Nadine?
Yeah, sure. I was just, thank you for giving me that moment. Yes, just yesterday it was released that over 2,000 deaths were drug-related deaths. But that's not to say that they related to homelessness. 3/4 of those were people who were housed, who had homes and fixed addresses. So that's not really the cause of death to homelessness, but it is a factor. We just have to remember that homelessness is a very complex issue. And so in that matter, we do need more consultation, but we can solve it. This is not a new concept out here. Just recently, you guys passed the bill to, or whatever it was, to emergency for crisis for homelessness. This isn't because of their lives, it's because of their deaths. So we do need to fix it. It can be fixable. it is a financial thing for sure, but if we're spending all this money on them being homeless and not housing them, it begs the question, is this actually more about keeping businesses afloat?
No, appreciate that. Thank you. And you know, I think some of the points made earlier by Councilor Paquette around whose lane is it, and how do you do it effectively within those lanes, is completely relevant and important to consider. Anyways, I was going to go on a bit of a different trajectory. I'm mindful this report is about mortality rates, and and I apologize I came in the middle of your speaking. But I think the point you both had around how to involve communities, say in this next phase of this task force, is a very interesting one to me, because, like you say, everyone's focused on survival. How do you expect people to participate on various committees and task force? And you've talked about how do you, people like you and who are part of this informal network, that you're very well connected. You have a lot of firsthand and your own lived experience to contribute. Because we could be boiling the ocean in forming that kind of like completely representative committee. We also have lots of research like we saw earlier. Like, I guess just like, what do you envision could happen for this next stage? And I appreciate this is not completely relevant to the report at hand, but I think kind of just want to follow up on some of the things you both said. Nadine, do you want to go first? And I'll come to you, Jordan.
Yeah, if I could. I agree, it is a multi-level government involvement, and the city may not have a lot of direct charter involvement because of our rights, but you represent the people in this city, so you are our voice. So you are the ones that we expect to go to the province and say, hey, this is not working, this is what we've come up with that could help, and then consult with them. But you also need to literally stand hand in hand with us in advocating.
Okay.
We really need that support. If we can have across the border collaboration on the advocating part, it'd be easier, I think, to get the notice of the province to say, you know what, we do need to address this. This is going to be something that can't wait.
Yeah. And Jordan, do you have any thoughts on? Thank you, Nadine.
Yeah.
Jordan, do you have anything to add on the task force piece?
Yep, like thank you. My expectation of that would be if community stakeholders are able to have some involvement, we can project new ideas, things that.
But what does that involvement look like? I guess is what I'm trying to get at.
Well, personally, I want a seat at the table.
Yeah.
I want to have a say, even as a private citizen.
Yeah.
Like, I see a bunch of great organizations listed, and I know a lot of the individuals who are being represented there, and they do great work.
I guess because there's so many people like you too. Like, I can think of 100 people. That doesn't make an effective governance structure for.
That's fair.
But I feel like, Nadine, you raised an interesting point around just like open channel, open communication, and the conduit. And if there is a better open relationship between you and those on the task force, and we do have a council member represented there, and if there's a way to kind of making sure those stories are brought forward, top of mind, that could be one way of having that information shared. I'm out of time, but anyways, I just thought it was an interesting conversation I want to pick up on. I'm sorry it was not entirely relevant to the report, but thank you for both being here.
Thank you, Councillor Tang. It looks like that is it for the questions for our speakers. Thank you very much for being here today. Next, we're going to go to questions of administration. Councillor Knack, do you have any? All right, Councillor Stevenson, please go ahead.
Thank you very much. I appreciate administration pulling this information together, and I also appreciate that you don't own the information. So, I think in addition to sort of laying out the very stark challenge and impacts that we have due to the current housing and homelessness crisis, the emergency that's on our hand, I think this speaks to the real impacts of that. I was wondering if there is, and it feels difficult to ask, I think as it was alluded to at the beginning of your presentation, these are very technical questions I'm going to ask, but of course they're about very tragic events, each and every one. I'm wondering if we have further information around cause of death, in terms of, exposure versus fire versus drug poisoning. Do we have any of that information?
No, we do not.
Okay. And the reason I ask these questions is that I think they have important implications about our policies, and if our policies are focused on protection of life, which I think at their very basis they always are always what we want to be focusing on. I think understanding what the causes of those deaths are is important to that. And then the other one, which is, weighs even heavier, is recognizing that decisions we make at this table, decisions that are made at other tables, have direct impacts on these statistics. Do we have a breakdown by month, let's say, and have we looked at that compared to different interventions or approaches or policies that have been introduced? No.
No, we do not have that information.
Okay. Is that information that administration is seeking or sees value in? Again, I think we struggle. It seems that a lot of the conversations we have around some of these topics, we struggle with narratives that are maybe unsubstantiated. So to be really blunt about it, is it more dangerous for someone to be in a tent that may be at risk of a fire, or for them to be unsheltered and at risk of exposure?
I can say that the work of the Office of the Chief Medical Examiner is governed by the Fatalities Inquiries Act. That is very prescriptive in terms of what is investigated, what data fields are filled in, and so it is highly prescriptive. I can also share, though, that there is improvement that is happening across the country. Edmonton is not the only municipality that suffers from a paucity of data. This is a nationwide and I would say worldwide phenomenon. As I mentioned in my introductory remarks, only since 2022 has homelessness been another category added. That is cold comfort, but it is progress. Mm-hmm. Another piece of progress is that at the Canadian level, there is a Canadian Coroner and Medical Examiner database. So there are many FPT tables, federal, provincial, and territorial tables, that are working to improve data collection and data sharing. We have not arrived, but I think that there is a recognition nationally that there is an opportunity to improve.
Yeah, no, I appreciate those systemic gaps and the opportunities there are to improve that. Are there any interim solutions that administration sees, again, to help us understand the real impact of choices that get made in terms of mortality? Again, is fire risk greater? Is drug poisoning risk greatest? Is exposure risk greatest?
I don't know if we or any other organization would be able to give you a hierarchy of worse things to die from. It's all horrible. I'm not sure.
It is. I mean, it's not a ranking of which one we want. It's what interventions are most effective, right? And do we try to solve one problem by creating a worse problem?
Councillor, I appreciate the question. I think given the limitations of both access and comprehensiveness of the data that's available, I think the sort of most prudent next step for us might be to continue to ask for the data and for the information consistently, so that maybe over time as our partners improve their technology solutions to the data gaps, we can get better data which we can then use to inform our decision making.
Great, really appreciate that. I have a couple other, I don't see anyone else on the board, but I can wait if anyone else wanted to click in.
Okay, we waited 4 seconds. You can go ahead for another round, Councillor Stevenson.
And actually, it's very short. It was just, I recall being at the Canadian Alliance to End Homelessness. I think it was just before the pandemic in late 2019. But I think that conference had a really interesting focus. It was a lot of medical practitioners, and I recall one doctor had specifically started writing in under cause of death was homelessness, and that was sort of a movement that I think was emerging in the medical field. So perhaps that's another avenue where there's, again, recognizing it's a national challenge, but I believe that the Canadian Alliance to End Homelessness had at least started some of that preliminary work. That was it. Thank you.
Thank you. I don't see any other questions to administration at this time. Councillor Knack?
I'll move receipt of information.
Thank you. Would anyone like to speak? Councillor Paquette, please go ahead.
Oh, thank you, Madam Chair. I feel like I'm sort of screaming into the wind here. Everything that we do, sometimes it's hard not to feel like it's falling on deaf ears. Everything we know, it's hard not to feel like it's falling on hardened hearts. It's very frustrating. There are people dying unnecessarily. The numbers that we got in this report are probably larger than what they look like, simply because of the way that we track the data or don't track the data. And what's really disturbing in this conversation is the idea that we can get more granular about exactly the ways that people are dying. That's where we're at with this federal government and with this provincial government. As if getting more granular is going to help the situation. It will give us a clearer picture. And maybe that's good. There will be ways that maybe we can help mitigate some of that once we know. But the clear answer is the one that no one is stepping up on the federal and provincial level in a meaningful way that will actually change the scenario and change the reality, not just for the people living and dying on our streets, but the people who are suffering on our streets and will die, or will have their bodies forever changed, or their minds forever changed, or their spirits forever changed. And the fact that this goes on day after day in a province that boasts wealth and opportunity is sickening. I am sick to my stomach. And every single person should be. That we would, and I say we, that other orders of government would rather waste money through inaction than use money strategically and intentionally to solve these issues. That message has to go out again and again and again. Other orders of government would prefer to see in Edmonton $320 million a year conservatively being wasted rather than using that money to actually address the problems and solve them. We should really think about that for a minute, because as Councillor Knack said, this is not just faceless adults. These are family members. These are children. And I cannot fathom the level of heartlessness or cluelessness that has to be employed to turn a blind eye to this kind of suffering. I am at my wit's end on what we can do as a council to get this message across. Logic isn't working. Appeals to the heart aren't working. Appeals to fiscal realities isn't working. I don't know what will work. Religion? Jesus said, when you have done it unto the least of these, my brethren, you do it unto me. Or maybe people don't actually care about that either. Maybe they just wrap themselves in that. I don't know. What I do know is that we have people without homes, without food, without care. And that does not have to be the case. Who benefits? And maybe that's where it is. Maybe that's where we have to start looking. Who benefits from the status quo? Because it's certainly not any of us. It's certainly not the people on the streets. Thank you, Madam Chair.
Thank you. Councillor Stevenson?
Thank you. Very, very briefly, topics don't get heavier than this, and I appreciate the comments of my colleague to highlight that much of this falls beyond our control in terms of our legislation, our mandate, our funding. There's also operational decisions that I think we make as a city that do have influence over at least some of these statistics. It's a heavy thing to grapple with. It's a heavy thing to face, but I believe it's true. So continuing to better understand and ensure that we look holistically at all of our decisions and reducing risks in one area, what that means for risks in other areas. Again, it's difficult to grapple with making life and death decisions, but it's something that I think we need to hold with us as we move forward. Continuing to get better understanding of what's happening and not turning a blind eye, I think is very important in that. I think to leave with some hope, I mean, this certainly underscores the incredibly vital work of the community plan, our own corporate plan as well, that we heard about this morning and will be coming up in June. So appreciate that we can feel heartbroken and helpless in the face of these numbers, but recognize there's still actions we can take to make them better. So thank you.
Thank you. Councillor Knack to close.
Yeah, thank you, Councillor Principe. First, just thank you for getting the information. I know, I didn't have any questions because you were just really getting the information on our behalf. But it's information that it's good that we all have it. At this point, I don't really know who we're talking to in these closing comments because everyone here in the room understands the severity of what we're dealing with, but yet still probably worth speaking to it a bit. I think the part that I sort of reflect on is, you see the number of 302 people, and I heard Nadine's comments that could be upwards of 400 from last year. I think about 10-ish years ago when we were seeing 30 to 40 fatalities on our city streets, the city took action on Vision Zero. And we've seen a lot of progress. Unfortunately, in the EPS annual report, we saw an upswing in 2023, which was a failure, I would say. We failed as a city on traffic fatalities last year because we had more people die on the street at 23 people than we did the year before, which was 14. That to me is a failure of all of everyone. We lost a lot of people, and yet we're talking about numbers that are at least 10 times that. And yet it's not treated with the same type of severity, to Councillor Paquette's point. If there were 300 to 400 people dying in traffic accidents, there would be uproar in our city. If there were 300 to 400 murders on our streets, people would be at our doors at City Hall until something changed. Yet it's 300 to 400 people who are losing their lives on the street, and understandably, our chamber's empty, and I'm sure there's a handful of people watching, and it's defeating at this point. Because I've said the same thing many times. Councillor Paquette said it again. Councillor Stevens said it again. That we have seen some small progress in the actual number of spaces where people can go to seek sort of temporary refuge, but as we've heard, they're not working for everyone, and I hope that with a full year of of more spaces, maybe that number begins to come down, but I don't think that alone is really going to solve this. It might level off the numbers, but that would still mean we'll continue to see 300 to 400 people who lose their lives. And I know, and this goes back to, the city, we put in money for shelters a couple of years ago, and the year before that, and the year recent, to try to fill in some gaps, but shelters won't solve a situation with 300 people losing their lives. It's going to be proper, dedicated wraparound supports in a 24/7 way, and then the supports up front so that people don't get to the point where they're falling into addictions, falling into these significant mental health challenges. And yeah, it feels sort of hopeless, because I feel like I've been having this conversation. Like, I felt 10 years ago we were having a conversation about 40 people per year, and that was still hard. And it's only gotten worse in my time on council. And you just sort of, I don't know how to fix it, because we're going to keep doing what we're going to do. Our city team are going to keep working tirelessly, as they have been every day for the last 10 years that I've been here, trying to help fill in where we can, trying to help. And I know people don't like the finger pointing piece, but at the same time, it's like, I don't know how we can fix it ourselves. And so we just need to keep talking about it and bringing attention to it, and make sure people realize, because I know we're going to keep doing what we can do. We're going to the frustration of some about the amount that taxes have gone up, we're going to continue to spend money on things that we need to, because it's that, or that number is even higher than it is, which is even further depressing thought. So I don't really have a point to speaking to this other than just to express a bit of my frustration and sadness and disappointment that we've actually gotten to a point where it's worse than it was 10 years ago. And if it was anything else, it would not be, Edmonton would be in an uproar asking for better, and we're not there yet. So we're going to keep working every day, and I'm looking over there as well, and we'll keep working together.
Thank you. I'll ask my council, or I should say committee colleagues, to please vote.
Just waiting on one vote. We have all the votes.
Please display the vote. And that has carried. Next, responses to councillor inquiries, none. Private reports, none. Motions pending, none. Notices of motion and motions without customary notice. Not seeing any, we are adjourned. Thank you, everyone.